Good morning, everyone. On the behalf of Faculty of Integrated Medicine, Dayalbagh Educational Institute, deemed to be University, Agra, I, Dr. Ankita Ukharwal and Dr. Suman Chaudhary, welcome you all in the last day of this FDP workshop. I hope after attending last 4 days session, everyone has gained knowledge about research, data collection, open access, and analysis tool and making data by using softwares. I hope we all are able to apply this knowledge and can take benefit of it. Yesterday, Professor M. Madhusudan, Mr. Nishant Singh, and Professor Saurabh Agrawal briefed us about their topic so well that no one is going to forget and surely will take the advantage from it. This 5-day FDP workshop will surely help us in our research field. Let me brief about today's session. It includes total 3 sessions. Dr. Rajneesh Sharma will take the first session, that is from 10:30 a.m. to 12 p.m. Professor A.P. Singh will take the second session, that is from 12:15 to 1:45 p.m. And after lunch break, we'll be having ending program of this 5-day FDP. Before starting today's session, please stand up and pay gratitude by doing prayer. Thank you, everyone. Now you all may please sit. Now I would like to welcome Dr. Rajneesh Sharma, Principal and Faculty of Integrated Medicine, Dayalbagh Educational Institute, Agra. He is a principal, professor, moderator, and member of Board of Secretary of several universities. I request Dr. Rajneesh Sharma to share his valuable knowledge on mental health and stress management. Please, sir.
Thank you, Dr. Ankita. And thank you all the participants who have joined. And I request all the participants to join the session because I am seeing that only 48 or something has joined the session. You have already told that not less than 80% attendance is needed for certification of this program. So all the participants are again requested to join. Now, before discussing on this mental health and stress management, basically whatever we are doing for last 4 days, you have gone through that the entire session was focusing on the research methodology, research working, and research related information and presentation. But it is a common question that why did we include this mental health? You know, this topic is entirely a medical topic, we can say. But what is the relation of this topic to this 5-day presentation? Dear audience, mental health is such a matter which do not exclude any sphere of the life, whether it is a house life, or it is a social life, or it is a political life, or it is a professional life, or we can say it is an institutional life. Basically, it is a condition where most of the time we do not aware that we are suffering from the mental disorder. How it happens? Most commonly you have seen in the life that the person suffering from schizophrenia or insanity never accept that he is a sick person. वो कभी नहीं बोलेगा कि वो मानसिक रूप से बीमार है. ऐसा क्यों? क्योंकि whatever the mental state of that fellow, he consider it as a normal things. But that is a scientific analysis which decide whether the person having the mental state or mental problem. Mental state is a condition where the different persons having the different analytic power, different level of understanding, different level of intellectual condition, different level of performing the task. But somewhere you will find that we are sometimes somebody observe and says that that fellow is not mentally normal. या बोलते हैं लोग हिल गया है क्या इसका दिमाग? ऐसा क्यों? Why it is so? That why this person is shaken mentally, why this person is abnormal mentally. So we can say whether whatever the profession, everywhere we will find such type of situation where the mental condition is not normal condition. But it is very difficult to find out, very difficult to understand. For example, we can say no one accept that mentally he is having any trouble. No parents will accept that his child is having abnormal behavior, abnormal understanding, until it is so deep, until it is so manifesting, until it is so disturbing. It means in the initial condition, we are unable to catch that disorder of the mind. So what is the situation? Means definitely if you are having a normal state, medically we can say that mind having the roughly the 3 component. Number 1, intellect. Intellect means what? Intellect means the ability to analyze anything. That is the intellect. Second thing, a memory. Means memory, if the person having the ability to recall the events, that is called a memory. That should be normal. Means person should not be forgetful. Person should be able to analyze the fact as it is. Third thing, willpower. Willpower means the determination capacity to do work. That will depend, no doubt, on the intellect analyzing the fact of the task. Means whether the person is able or the person is not able, whether I can do the things or not. This determination, all the things are mathematical in calculation. Means Intellectual level will decide mathematically about the fact. Willpower will decide mathematically the ability. Similarly, the memory or recalling capacity will decide all this atmosphere. Means we can say that these are the normal sphere of the mind where we can judge, where we can find out, where we can decide whether the person is normal or not. Now, by this thing, you can say that at the level of institutions or also where there are basically two parts, means teaching part of the institution, non-teaching part of the institution. Non-teaching part means the administration and all these things. Teaching part means the teachers or the students. So by this mental condition, by the stress management, we cannot say that institutions are without stress. We cannot say that institutions are without mental disorder. We cannot say that institute have not the mental problems. Means where? Means whether it is the administrative part or it is the teaching part, we have the trouble. We have somewhere the fault. We have somewhere the mental disorders, and we have to manage the stress. Means work may not be without stress, but how up to what level we can manage the stress, that is the question. So before discussing all these things, before going to detail, we can say that this topic is belonging to a medical part. Therefore we have decided to brief the things for the level of institute, for the level of teachers. I will try to make you understand commonly what may be the disorder and how to identify them, because what are the factors, what are the management, what are the manifestations by the person, how the mental disorder can be identified. So we can say that these things are very important. If you will see after the completion of this thing, that though these are less interesting for you because it is a medical topic, and I do not know how many participants belong to it, though it is a less interesting, but it is not less important. So we should start the things. Friends, you see, that mental health and stress management means we do not intend here with the management part that we are becoming a medical professional. It is a general management, how to manage generally, how to manage at our level without a medical help. That is the part. Means we are not discussing here the therapeutic part. We are not discussing here the therapeutic part, basically, which is a part of medical science, but in general discussion for the purpose of institutions. So start with the brief. Before starting, what is a health? The World Health Organization defines health is defined as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Means WHO says that health does not mean that we are having the disease at physical level only. It is also a well-being at the level of society, at the level of mind, at the level of physics also. Means physics means physical, which can be observed, which can be felt, which can be seen. Disorders just like which can be named as a disease at the physical level, means tissue level. For example, diarrhea, for example, vomiting, for example, fever, for example, abscess formation, for example, injury. These are the physical disorder. Mental means whether the person are normal at the mind level or not. Social means society is a special component, because you know that we are belonging to a social animal. Science defines the human being as a social animal. Social animal means what? The human being needs the society for living, society for surviving, society for the life, society for the happiness, society for the good feeling. So we can, according to WHO, we should be normal at the level of physical, at the level of mind, at the level of society. So friends, this is the condition of health. Now WHO says about the mental health. So what is the mental health? Mental health is a state of well-being in which an individual realizes his or her own ability, can cope with the normal stress of life, can work productively, and is able to make a contribution to his or her community. You see how clearly WHO defines that mental health is a well-being, means you should be normal, you should be well, individual should be well, or individual should be able to realize means what? Realize ability means what is the ability, or we can say up to what level the person can do the things. That is the ability. To what level person can cope with the normal stress of life, means we can say that everywhere in the every step in the life we face the stress, but it does not mean that every stress must be a disease. Stress is a normal thing if we are doing. So stress is a normal thing. So whatever you are doing, whatever the task you are performing, it will create the stress, but it does not mean that we will fall sick. So we should be able to adjust, we should be able to realize, we should be able to handle the common stress of the life, can work productively. Productively means what? Every person needs some creation. Some creation means creation in the work, creation in the duties, creation for the society, creation for itself, creation for the family, creation for our responsibilities. So we all having the responsibilities towards ourselves, towards the family, towards the society, towards the community. Means according to the mental, we should be normal at this level. We should be normal at this level. So if we are facing any trouble to handle all these things, as the definition says, that a state of well-being in which an individual realize and can cope with normal stress, can work productively, and is able to make a contribution to his or his community. Means if we are a component of the society, so we will have certain responsibility toward the society. So that responsibilities must be discharged, that duties must be discharged to the community. If we are not doing that thing, it means somewhere mentally we are sick. Somewhere mentally we are sick. Now, you see, mental health is not exclusively a matter of relation between persons. Somewhere we can say that somebody is not in the relation of community, not in the relation of individuals. So the पागल आदमी है, बोलो वो किसी से संबंध नहीं रखना चाहता. हम बोल देते हैं वो पागल आदमी है यार, वो किसी से संबंध नहीं रखना चाहता. सो मेंटल हेल्थ इज नॉट एक्सक्लूसिवली मैटर ऑफ रिलेशन बिटवीन पर्संस. दो व्यक्तियों के बीच का रिलेशन ही सिर्फ मेंटल हेल्थ नहीं है. इट मींस इट इज अ मैटर ऑफ रिलेशन ऑफ द इंडिविजुअल टुवर्ड्स द कम्युनिटी ही लिव्स इन. मीन्स हमारा समाज के साथ भी संबंध होना चाहिए, हमारा कम्युनिटी के साथ भी संबंध होना चाहिए. जिस सब कम्युनिटी में हम रह रहे हैं, जिस सोसाइटी में हम रह रहे हैं, जिस कम्युनिटी के हम पार्ट हैं, वहां भी हमारे संबंध नॉर्मल होने चाहिए. दैट लेवल आवर रिलेशन शुड बी नॉर्मल. मीन्स टुवर्ड द सोसाइटी ऑफ विच अ कम्युनिटी इज अ पार्ट. नाउ कम्युनिटी इज अ बिग थिंग, है ना. सोसाइटी और कम्युनिटी, वी कैन से दैट दीज आर द थिंग्स which define a group of the individuals, group of the persons, where the society or community, we can say, for that we are having the need of some relationship. सोसाइटी में हमारे अगर संबंध ना होंगे तो हमको सर्वाइवल में दिक्कत जाएगी, हमको सोशल लेवल पे दिक्कत जाएगी, हमको पारिवारिक लेवल पे दिक्कत जाएगी. इसका मतलब ये सोसाइटी में, कम्युनिटी में हमारी रिलेशनशिप नॉर्मल होनी चाहिए टुवर्ड द सोशल इंस्टीट्यूशंस, है ना. नाउ व्हाट आर द सोशल इंस्टीट्यूशन व्हिच इज द लार्ज पार्ट गाइड हिज लाइफ. Social institutions are that organizations somewhere which are responsible for our social life. So we should have the responsibility toward these institutions, determine his way of living, working, leisure, and the way earn and spend his money. Means somewhere एक आदमी है मान लो जो कमाता तो 10 रुपए, खर्चा करता है 100 रुपए. हम उसको एक नॉर्मल कंडीशन नहीं बोल सकते. बाकी के 90 रुपए कहाँ से लाएगा? Means how the person living, how the person is working. Somewhere we are having some responsibility, we are having certain structure where we are working. जहां भी हम काम करते हैं वहां काम करने का एक स्ट्रक्चर होता है, काम करने के कुछ कंपोनेंट होते हैं. तो जहां जिस इंस्टीट्यूट में, जिस वर्क प्लेस पे हम लोग काम करते हैं, देयर इज सम स्ट्रक्चर of the working, some structure of the institution. So we should be fit in that structure for the working, for the living, and we should maintain. The leisure means what? Means loss and profit. Loss of profit. Loss and profit is not only merely a condition of finance. It is everywhere. Somewhere we are losing the relations, somewhere we are gaining the relations. That is also a leisure way of earn and spend his money. पैसे की व्यवस्था हम कैसे करते हैं? बिकॉज हमारा हिंदुस्तान बोलता ही है कि आदमी के 4 पुरुषार्थ होते हैं, अर्थ, धर्म, काम और मोक्ष. इसमें जो अर्थ है ये बहुत बड़ा कंपोनेंट है. द मनी इज द वेरी बिग कंपोनेंट ऑफ द लाइफ. सो वी शुड बी एबल टू मैनेज दिस मनी, manage to earn, manage to spend this money. If we are failure at that level, somewhere we are guilty, somewhere we are at the fault. Means we are not judging exactly what is the things. That is the somewhere the fault is being appear. The way he is seeing happiness, stability and security, the way he sees happiness. मानी कहाँ हमारा जो लाइफ है वो कहाँ किस तरह से संतुष्ट होगा, वेयर आवर स्टेबिलिटी इज. मीन दैट इज ऑल दीज थिंग्स आर कैलकुलेशंस ऑफ द लाइफ. ये हमारे लाइफ की जिंदगी की गणनाएं हैं कि हम कैसे करते हैं, कि हम कहाँ खुश रह सकते हैं, हमारी हैप्पीनेस का कारण क्या है, हमारी हैप्पीनेस हम कहाँ खोजें, हमारी खुशी हम कहाँ खोजें, हमारी स्टेबिलिटी हम कहाँ खोजें, हमारी सुरक्षा कहाँ है. सो समवेयर इफ वी आर नॉट नॉर्मल एट द मेंटल एबिलिटी, एट द लेवल ऑफ एनालिसिस, then we will be failure in these things, finding these things. Now survey in India, you will surprise the survey of mental morbidity carried out in various parts of the country suggests a morbidity rate of not less than 80 to 20 per thousand, and the type of illness and their prevalence are very much the same as in other part of the world. It's surprising. You will see 18 to 20 per thousand is a big number. It is a big number. It is not a less. It is a big number that so persons are having the morbidity or the mental disorder. माने every 1000 contains 80 to 20 person who are sick at mental ground. माने 1000 में 18 से 20 लोग मानसिक तनाव से ग्रस्त हैं, मानसिक बीमारी से ग्रस्त हैं, और उनको पता ही नहीं. क्यों नहीं पता है? क्योंकि हम उसकी तरफ ध्यान नहीं देते. वी डू नॉट केयर अबाउट दैट. So it is a big number, and now you may calculate that in whole of the country how a big population is suffering from this mental stress or mental morbidity. Mental morbidity means the disorder related to the disease of the mind. So that is the condition, how the persons are suffering, but we are not aware about that. Now see, characteristic of a mental health person. It is a good thing. Now it is interesting. Mental health is not mere absence of mental illness. सिर्फ मानसिक बीमारी न होना ही mentally healthy होने का लक्षण नहीं है. We cannot say that if the patient is not ill, it means that he is mentally healthy person. No, mentally healthy person has 3 main characteristics. Good thing, he feels comfortable about himself. That is, he feels reasonable, secure and adequate. He neither underestimate nor overestimate his own ability. He accepts his shortcomings. He has self-respect. Now see, this is the things how we should calculate. Means he feel comfortable about himself. अपने बारे में उसको सारी चीजें पता होनी चाहिए. अगर हमें यही नहीं पता है हम क्या कर सकते क्या नहीं कर सकते, we should have at least ourselves known. Means knowing the thyself is a component of a mental health. We should know our ability. Being a medical professional, I cannot teach the mathematics. Being a mathematician, somebody cannot teach the medical science, somebody cannot teach the other things. A linguist cannot teach a science. Means these are the abilities. Overestimate or underestimate, both things are not normal. According to your ability, you must understand that what are the sphere of action, what is the ability, what is the boundaries of my working, what is the boundaries of my ability. We should know this thing. He accept the shortcomings. Mostly we avoid this thing. Nobody is easily accepting the shortcomings. हम अपने अंदर की बुराइयों को देखना नहीं चाहते. ये एक सबसे बड़ी समस्या और ज्यादातर लोगों के साथ में है कि कभी भी हम ये एक्सेप्ट ही नहीं करना चाहते कि हमारे अंदर भी कोई कमी हो सकती है. एंड दैट इज द रीजन व्हाई वी मोस्टली ओवर एस्टिमेट अवर सेल्फ. क्योंकि हम सोचते हैं हमारे अंदर कोई कमी है ही नहीं, हमसे ज्यादा होशियार दुनिया में कोई है ही नहीं. ये सबसे बड़ी मुसीबत है. इसका मतलब क्या हुआ कि मतलब जब हम ये सोचेंगे कि हमारे अंदर कोई कमी नहीं है, हमसे बड़ा कोई दुनिया में होशियारी नहीं है, तो ये अपने आप में एक बीमारी का लक्षण. ही हैज सेल्फ रिस्पेक्ट. सेल्फ रिस्पेक्ट का मतलब ये नहीं है कि हम दूसरे को बेइज्जत करें. इट डजंट मीन दैट वी शुड इंसल्ट समबडी. सेल्फ रिस्पेक्ट का मतलब है वी शुड नो द फैक्ट अबाउट अवरसेल्फ, दैट इज सेल्फ रिस्पेक्ट. द मेंटली हेल्दी पर्सन फील्स राइट टुवर्ड्स अदर्स. गुड थिंग. Every time criticizing somebody, that is a mental disorder. We can say that ये पागल आदमी है, हमेशा दूसरे लोगों की बुराई ही करते रहता है. See, मतलब all these things we hear around us every day, but we never care. Now how these silly things are here that mentally health person feels right towards others. दूसरे के बारे में भी वो अच्छी तरह से ही सोचेगा. अब सवेरे शाम तक हम किसी व्यक्ति की बुराइयां ही करते बैठेंगे, इसका मतलब वो तो आदमी ठीक है, हम मानसिक रूप से बीमार हैं. इसी तरह से दूसरे व्यक्ति के बारे में हम सवेरे शाम तक स्तुति वंदना ही करते रहेंगे और we will be appreciate, we will do the buttering of the persons. That is a mentally sick person. That is a mentally sick person. He does something about the problem as they arise. He is able to think for himself and take his own decision. He sets reasonable goal for life. Means that is the important. Means in the life, person must have a goal. Person must have a target. Person must have an object. What is the object of our life? That is a philosophical, that is a material. Materialistically, we should know what are the things responsible or needed for our existence. Then spiritually, what is the needed? Why we have come to this world? So what is our goal? हम इस दुनिया में आए ही क्यों? हमारा गोल क्या है, हमारा उद्देश्य क्या है, हमारी लाइफ का पर्पस क्या है? अगर हम ये नहीं जान पाए तो हमारा कहीं ना कहीं हमारा मानसिक लेवल पे कहीं ना कहीं हमको दिक्कत है. नाउ सी टाइप ऑफ मेंटल इलनेस. नाउ इफ यू सी द मेंटल इलनेस, अब बात आती है इलनेस की, बीमारियों की. बीमारी क्या है? व्हाट इज द मेंटल इलनेस? डिसीज. व्हाट आर द डिसीज ऑफ द माइंड? मेंटल एंड बिहेवियरल डिसऑर्डर्स आर अंडरस्टूड एज द क्लिनिकली सिग्निफिकेंट कंडीशन. करेक्ट. क्लिनिकली सिग्निफिकेंट कंडीशन मींस at the clinical ground, according to the medical ground, what are the mental illness? What is the mental illness? So alteration in thinking, mood or behavior associated with person distress or impaired function. Alteration in thinking माने एक व्यक्ति का जो नॉर्मल थिंकिंग का प्रोसेस है, if that normal thinking process if change, normally if the thinking process change from usual, it means somewhere is the fault, therefore person is unable to think. For example, if a teacher having the routine that we have to take the class, we have to assess the student, we have to take the examination, we have to evaluate, we have to prepare the lecture, we have to do other extracurricular activities in the department or somewhere else. But after that, alteration in the thinking, if teacher is not interested in the teaching, not interested in the working, he is isolated, he is sitting in the corner of the department, he is doing all these things in innocence, but not interested to his job, means somewhere the process of thinking of a teacher has changed. It means somewhere there is the mental illness, mood, emotions, behavior associated with personal distress and impaired function. Now see, sometimes we see that somebody for some days becoming the irritable. देखते हैं कभी कभी कोई आदमी यार वो एक हफ्ते से यार बड़ा दुखी कर रहा है, आदमी क्यों दुखी कर रहा है, बार बार चिढ़ जा रहा है, वो सवेरे शाम तक चिढ़ा हुआ रहता है, सवेरे शाम तक गुस्से में रहता है, that is emotion or behavior associated with personal distress or impaired functioning. इसकी वजह से उसका काम खराब होगा. That change in the emotion, that change in the behavior will defect the functioning of that fellow. Means it will indicate that person having the mental illness. Means alteration in the thinking. This thinking alteration will cause the change in the behavior. Then the international classification of disease. Behavioral disorder. Medically, you will see that organic, including symptomatic mental disorder, जहाँ पे हमको symptom मिलते हैं, dementia, Alzheimer's disease, delirium, mental and behavioral disorder due to the psychoactive substances, harmful use of alcohol, opioids dependence syndrome, schizophrenia, delusion disorders, paranoid, schizophrenia, delusion disorders, acute and transient psychotic disorders. I mean, these are the medical classification of the diseases. We will discuss one by one all these. Now, mood affective disorders. Somewhere person having the mood change, means bipolar affective disorder, depressive disorder, neurotic stress related and somatoform disorders, generalized anxiety disorder, obsessive compulsive disorder, behavioral syndrome associated with psychological disturbances and physical factors. These are the medical classification, and we will brief whether you can find or not, it doesn't matter. But we should be able to identify whether somebody is suffering from the mental disorder or not. Now, mental illness is a vast subject. I told you, it is a separate branch. It is a separate branch of psychological disorders, mental disorders. So we have to brief very shortly that which things are important for us for understanding of ourselves. Mental illness is a vast subject, broad in its limit and difficult to define precisely. There are major and minor illness. The major illness are called psychos. आपने देखा होगा क्या है यार, साइको आदमी है. साइको आदमी को दूसरे शब्दों में पागल भी बोलते हैं, इंसेन बोलते हैं. ये यार उससे बात मत करना, साइको है वो. तो साइको का मतलब क्या हुआ? इट मींस द इंसेन पर्सन, पागल पर्सन, ल्यूनेटिक पर्सन एंड आउट ऑफ टच विद रियलिटी. और ऐसा व्यक्ति, उसको फैक्ट से कोई लेना देना नहीं है, उसको रियलिटी से कोई लेना नहीं है. देयर आर 3 मेजर इलनेस. If we are discussing about the major illness, then schizophrenia, split personality, in which the patient lives in the dream world of his own. Schizophrenic person always having the imaginations. There is no relation with the reality to that fellow. That is called a schizophrenia. The true insane person. True insane person means he will dream everything. He will imagine everything. And the imagination will be of high intellect. And that imagination does not have any relation with the reality. Manic depressive psychos, in which the symptoms vary from height of excitement to depth of the depression. Manic depressive means somewhere person is overexcited. Overexcited means angry, abusive, quarrelsome, and sometimes is very depressed. He will sit isolated in the room in a corner and will not talk to anyone. So that is the condition how these persons are work. Paranoia, which is associated with the undue and extreme suspicious and progressive tendency to regard the whole world in the framework of delusion. Means delusion, imaginations again, and suspicious. That is the important part. Means person do not believe anybody. Do not believe anybody. Always he will suspect every person. That is the condition. Now see the minor illness area. Neurosis or psychoneurosis. In this, the patient is unable to react normally to life situations. Whatever the life situation, he is not considered the insane by his associates, but nevertheless exhibits certain peculiar symptoms such as the morbid fear, compulsion and obsessions. आदमी कभी मानेगा ही नहीं कि मेरे को मेंटली डिसऑर्डर है. न्यूरोसिस और साइकोन्यूरोसिस कंडीशन मींस कंपल्शन. ये रिजिड हो जाएगा आदमी, रिजिड हो जाएगा. वो बोलेगा मैं जो बोल रहा हूँ वही सही है, या जो कुछ मेरे कब्जे में है वही है. मतलब उसकी जो रिजिडिटी ऑफ द थॉट्स, that is the very peculiar symptom. Some patient having the undue fear. Undue fear means there is no reason of the fear, but patient have. So these are the condition of neurosis. Now the personality and characteristic disorder, this group disorder are the legacy of unfortunate childhood experience and these perceptions. Personality and characteristic disorder. चाइल्डहुड एक्सपीरियंस माने बचपन में कोई घटनाएं घट गई, उन घटनाओं की वजह से उसके ऊपर कोई प्रभाव आया, and because of that if the person having the abnormal reactions at the level of mind, that comes in this category. Now if you will see, there are many known factors of agent, host, environment in the natural histories of mental disorder. Now why these mental disorders appear, why these mental disorders comes in a person, why these mental disorders are created in a person, and what are the cause, what are the factors, what are the agent which are causing these disorders. Among the known factors are the organic conditions. Mental illness may have their origin in the organic conditions such as the cerebral arteriosclerosis. These are the medical conditions where the person having the certain pathological condition in the mind. So because of certain pathological condition in the mind, for if you will see that certain person because of the hypertensive condition, because of the bleeding or because of the blockage in the arteries, the person becomes insane. So that may be the one of the causative factor where the circulation is not proper to the mind, and somewhere that the sclerotic changes, somewhere the disease has created certain things. So these are the condition where the person suffering from the mental condition. Now the heredity, this is important part. Heredity may be an important. Heredity may be an important factor in some cases. For example, the child of two schizophrenic patient is 40 times more likely to develop schizophrenia than the child of healthy parents. My God. So that is the hereditary factor. Means if a person having the schizophrenic condition, एक अगर किसी के फैमिली में कोई पागल है, तो 40 गुना ज्यादा संभावना है कि उसके परिवार के बच्चों में भी ये पागलपन आएगा. इसका मतलब ये है, दिस इज द स्ट्रॉन्ग हेरिडिटरी फैक्टर इन कंपैरिजन ऑफ नॉर्मल पर्सन. इफ वी डू नॉट हैव any type of schizophrenic condition, then we are on safer side. But if we having the schizophrenic condition, there are 40 times more susceptible our generation that it will have the schizophrenic condition or the mental illness. So that is the heredity. Heredity strongly matters about the mental condition. Now the socio-pathological causes. To produce any disease, there must be a combination of genetic and environmental factors. Sure, means not merely the genetic factor, but the surrounding also cause. Surrounding also matters. The social and environmental factor associated with mental ill health comprises the worries. माने हमेशा चिंता में रहना, हर दम चिंता में रहना, एंजाइटी, हम हर समय जो है ना परेशान रहना, इमोशन स्ट्रेस रहना, हमेशा हमको तनाव में रहना, इमोशनली भावनात्मक रूप से टेंशन रहना, फ्रस्ट्रेशन रहना, है ना, अनहैप्पी मैरिज, दीज आर द फैक्टर्स. अनहैप्पी मैरिज, कोई अपनी शादी से ही खुश नहीं है तो धीरे धीरे करके वो डिप्रेशन में चला जाएगा. ग्रेजुअली ही विल गो इनटू द डिप्रेशन और द मेंटल इलनेस इफ ही इज नॉट हैप्पी विद द फैमिली लाइफ. ब्रोकन होम्स, that is a major factor. I told you earlier that human being is a social animal. So if the home means what? Home is the atmosphere of certain members. It is the atmosphere of certain members. If that atmosphere is broken, similarly, person having the poverty, financially suffering. If the person is financially suffering, industrialization, urbanization, means you are having the habit of living in a certain atmosphere, and that atmosphere has changed to the urbanization, changing family structures. Suppose some person having the habit of living in an isolated or nuclear family, and suddenly the lifestyle change and he has to live in joint family, then definitely the person will suffer. Population morbidity, economical insecurity, cruelty, rejection, neglect, and the likes. These are the certain factors where the mental illness may be caused. आदमी मानसिक रूप से परेशान हो सकता है, बीमार हो सकता है. These are the factors which are present around us. So you will see, अब what is the need of the man? आदमी को किन चीजों की जरूरत होती है? आदमी को अफेक्शन चाहिए, उसको दूसरों से भावनात्मक लगाव चाहिए. If we are not affectionate, if we are not in touch emotionally, emotional attachment चाहिए उसको, आदमी को. तो इमोशनल अटैचमेंट अगर आदमी को नहीं मिलेगा तो मेंटली आदमी परेशान हो जाएगा. He will be sick mentally, he will be ill mentally. Belongings, जिंदगी जीने के लिए उसको सामान की जरूरत होती है, जिंदगी जीने के लिए उसको असेट्स की जरूरत होती है, जिंदगी जीने के लिए उसको मटेरियल्स की जरूरत होती है. दैट बिलोंगिंग्स मस्ट बी देयर, दैट बिलोंगिंग शुड बी देयर विद द मैन. Independence, somewhere in the life, somewhere patient needs the independence. Independence means we should not always be depend on somebody. We should be self-settled. We should be able. Independence means we should be able. We should not always be depend on certain persons. We should achieve. Everyone having the target in the life. Everyone having the object in the life. So if we do not have the achievements in the life, definitely these are the factors. They may cause the disturbances at the mental level. Sense of personal worth. Sense of personal worth means what? Means every person needs that. He must have a value around the society, in the surroundings, in the society. He must have a value. He must be appreciated. He must be respected. He must be valued. So that should be self-actualization. That is another factor. Self-actualization means, if you will see, these are the factors which are necessary to be in society. If a human being is a part of society, then these are the factors which are most essential to be in society, to be recognized in the society. समाज में एक अस्तित्व के लिए, समाज में एक सम्मानजनक जीवन के लिए इन सारी चीजों की जरूरत होती है. अगर इनमें कहीं कमी पड़ती है तो निश्चित रूप से मानसिक रूप से आदमी परेशान होता है. Disease which affect mental health. Now अब बात ये आती है कि ऐसी कौन सी डिसीजेस हैं कि जो मेंटल हेल्थ को परेशान करती हैं. ना देखिए, मेंटल हेल्थ, डिमेंशिया दिक्कत देगा हमको, डिप्रेशन दिक्कत देगा हमको, सिजोफ्रेनिया दिक्कत देगा. Now depression is a state of low mood, aversion to activity. Generally we observe so many persons. If you at the workplace, if you will find that we are always, everybody want to enjoy in a group of 4 or 5 persons sitting in the group and doing the talking and the innocence talking. Sometimes we are doing all these things. कभी कभी हम लोग ग्रुप में बैठे रहते हैं, गप्पे मारते रहते हैं. तो एक sometimes somebody is that who do not like this sitting in the group or sitting somewhere where the persons are discussing the general things. He will be isolated. Where the persons are sitting, he will leave that place and will sit somewhere else in the isolated in the corner, or he will be busy with himself. That is the isolation. Means person will not like the sitting with others. दूसरे लोगों के साथ बैठना उसको पसंद नहीं है, वो इन चीजों को अवॉइड करेगा. दूसरी चीज, लो मूड, उसका मूड ही नहीं होता. काम के लिए बोलेंगे मना कर देगा, हंसने के लिए बोलेंगे मना कर देगा, बाजार जाने के लिए बोलेंगे मना कर देगा. नहीं, मेरे को नहीं जाना है जी, मेरे को बात नहीं करनी है जी, मेरे को नहीं खेलना है, मुझे टीवी नहीं देखना है, मुझे एंटरटेनमेंट के लिए नहीं जाना है, मुझे शादी में नहीं जाना है, मुझे पार्टी में नहीं जाना है. So these are the condition. Means every step person want to avoid the society. That is the low mood and aversion to activity. Now, how? Classified as a mental and behavioral disorder, the experience of depression affects. Now, डिप्रेशन से क्या क्या चीजें अफेक्ट होंगी? देखिए, पर्सन थॉट्स, निश्चित रूप से पर्सन के थॉट्स हैं वो अफेक्ट होंगे. बिहेवियर चेंज होगा, मोटिवेशन चेंज होगा, फीलिंग चेंज होगी, सेंस ऑफ वेलबींग. उसको हमेशा लगेगा मैं तो बीमारी रहता हूँ, मैं कभी ठीक नहीं हो सकता. द पर्सन थिंक्स दैट ही नेवर बी वेल. मीन्स that is the condition how the depression causes. Now you see, these are the things we always observe. और लोग बोलते हैं ना कि यार वो तो कहीं जाता ही नहीं है, वो अपने घर में किसी को आने नहीं देता, ना वो किसी के घर में जाता है. Means उसको पसंद ही नहीं है. So we can say that person in the condition of depression, we can say. Now the core symptom of depression is said to be loss of interest or loss of feeling of pleasure in certain activities that usually bring joy to people. Now देखिए कितनी बड़ी बात है कि जो बेसिक सिम्टम है डिप्रेशन का, वो बेसिक सिम्टम ये है कि जिसमें दूसरे लोगों को मजा आती है, वेयर द अदर पीपल्स फीलिंग हैप्पी, दैट पर्सन विल नॉट हैव एनी इंटरेस्ट इन दैट एक्टिविटीज, और उसके लिए उसके पास कोई इंटरेस्ट नहीं है, कोई फीलिंग नहीं। माने जहां आप लोगों को नॉर्मली अच्छा लगेगा, उस जगह के लिए उस व्यक्ति के पास कोई फीलिंग नहीं है, उसको कोई इंटरेस्ट नहीं है, वो नहीं जाना चाहेगा। आप लोग शादी में जाना चाहते, दावत में जाना चाहते, वो नहीं जाएगा, मना करेगा, मैंने को नहीं जाना, मैं नहीं जाना। I do not want to go into the marriage parties. I do not go onto in the fair or to see the movie or to see the circus or somewhere else. So now, in a normal temporary reaction to life events such as the loss of loved one, and it is also symptoms of some physical diseases and side effects of some drug and medical treatment. Sometimes depression may be because of these things. These are the most important things. You have seen in the life that somebody having the such situation that unexpectedly some beloved person has been lost. So that fellow having the feeling, having the depression because of that, because of that event, which is widely affected the mind of that fellow, so person goes into the depression. Symptoms of some physical diseases. There are certain physical diseases, medically we can say there are certain physical diseases where person having the condition of depression, and side effect of some drug and medical treatment. That is also the things. Nowadays, because the doses of the medical treatment are too large, these are the chemicals. So quite naturally, they are creating certain adverse effect along with the beneficial part of the treatment. Some drugs causes the effect over the mind and they create the depression, but we cannot leave the treatment because that disease is more important than this mild symptom of depression. So there's a side effect. Drug induced depression may be there. We have to find out which drug. So as far as possible, we should select the alternate option for that particular drug which is causing the depression. It may feature sadness. It may feature difficulty in thinking or concentration. That is quite good. Means therefore the output, therefore the creativity, there the productivity of the person is affected because patient is always sad. हर समय दुखी रहेगा, वो कभी खुशी नहीं होगा, उसके चेहरे पर हमेशा ही 12 बजे रहेंगे, आपको लगेगा कि यार ये ऐसा सवेरे शाम तक चेहरा बनाए रहता है, क्या करना है इस आदमी का। लेकिन उसका दोष नहीं है, वो जानबूझ के नहीं बनाता, बिकॉज द पेशेंट ऑफ डिप्रेशन, वो डिप्रेशन का मरीज है, उसका क्या करेगा, उसका सवेरे शाम तक चेहरा वैसा ही रहना, तो वो जानबूझ के नहीं करता। मैंने डिफिकल्टी इन थिंकिंग, है ना, आप उसको बोलोगे कि भाई इसके बारे में सोच के रखना कि क्या करना है, तो वो नहीं सोचेगा, बोले मैंने कुछ नहीं करा, मेरे को नहीं पता, तू कर लो। बिकॉज द लेवल ऑफ थिंकिंग इज सो लो, पेशेंट डू नॉट वांट टू थिंक, patient do not want to analyze, the patient do not want to realize the things, and concentration तो 1% उसको होगा नहीं, क्योंकि कंसंट्रेशन और थिंकिंग एक दूसरे से रिलेटेड है। पेशेंट इज अनेबल टू कंसंट्रेट means if he will do that, it is the function of work of 2 hours, he will not do, करेगा ही नहीं वो, ठीक है। तो now you see, and significant increase or decrease in the appetite and time spent sleeping. These are the things. Mentally depressed person either will overeat, but in most of the cases you will see that person having the loss of appetite, वो खाना कम कर देता है। डिप्रेशन वाले पेशेंट का खाना हमेशा ही नॉर्मल आदमी से कम रहता है, ज्यादातर केसेस में ऐसा देखा गया है, बट इन रेयर केसेस इट मे बी मोर एपेटाइट एंड स्लीपिंग। जनरली डिप्रेस्ड पर्सन डू नॉट स्लीप, हैविंग द defective sleep, may be sleepy in the day but sleepless at the night. So we can say the sleep is also disturbed in the depressed person. People experience a depression may have feelings of dejection, hopelessness, sometimes suicidal thoughts. My God, suicidal thoughts also means sometimes person is so depressed, so negative thoughts. There's suicide tendency because of the negative thinking. So that negative thinking up to so level that patient sometimes thinks about the suicide or sometimes commits the suicide. कभी कभी वो सुसाइड कर भी लेता है, इस तरह का पेशेंट। therefore the suicidal condition is one of the major and harmful thoughts in the person who is suffering from the depression. Very commonly heard word that the schizophrenia is a mental disorder characterized by the continuous or relapsing episode of psychosis. Schizophrenia is an extreme condition. It is a condition of insanity. It is a condition of mental disorder which is having the repeated episode. repeated episode, and sometime it is increasing in the intensity. Major symptom includes the hallucination, typically hearing voice. You will see that patient says that somebody was discussing about me, but there was no person. तो कोई बात कैसे करेगा जब था ही नहीं कोई? It means schizophrenic persons having the hallucination delusion. Delusion means he sees the false image. तो बोलते ना भूत दिख गया उसको, भूत उसके कान में कुछ कह रहा था. So typically these are the symptom of schizophrenia. Typically these are the symptom of schizophrenia. Means hallucination, typically hearing voice, माने false voice he hears. उसके कान में कोई बोल रहा है, उसके बगल में कोई चर्चा कर रहा है, रूम में कोई आदमी बातें कर रहा है, इस तरह की उसको चीज आएगी. दूसरा, वो लोगों को देखेगा, इमेजिन करेगा कि भाई ये आदमी मेरे ऊपर डंडे से मेरे को मार रहा है, मेरे ऊपर कोई पत्थर फेंक रहा है, मेरे ऊपर चाय फेंक रहा है. सो दीज आर द फीलिंग्स, दीज आर द delusions he feels. And disorganized thinking means thoughts will be changed. Other symptoms include social withdrawal. Means schizophrenic patient never like the society, never likes the company, never like the sitting somewhere the persons are sitting. So this patient always like the isolation. He will not be interested in the social events. He will not be interested in the social parties. So from the society, he will withdraw himself. Means that schizophrenic person is isolated. He like always to sit at home. He always like to sit individually, not in a company. Symptoms typically come or gradually being in a young adulthood, and many cases never resolve. That is the condition of schizophrenia. Means in most of the cases, you will see that schizophrenia is not permanently treatable. The person have to take the treatment continuously because the cases cannot be resolved throughout the life. That is the condition of schizophrenia. Now the dementia. The most common early symptom is difficult or remembering the recent events. As the disease advanced, symptoms can include problem with language, disorientation, mood swing, loss of motivation, self-neglect, and behavioral issues. Means dementia means forgetfulness. We can say the forgetfulness. This forgetfulness, भुलक्कड़पना जिसको हम लोग बोलते हैं, ये भुलक्कड़पना होने के पीछे के कई कारण हो सकते हैं. That may be because of the old age changes. That dementia may be because of the psychological disorder. This dementia may be because of the pathological changes in the brain. That dementia may be because of the depression. So we can say, means memory, impaired memory is called dementia. Memory, we have defined the memory is the recalling the events. So the recalling events, whether these are the recent or old, that is the condition. Means chronic dementia or acute dementia. We can say that the recent events may lose. Sometimes you will see that in case of hypertensive patient, where the person having the bleeding in the mind or we can cerebral episode, that patient also having the dementia, that patient also having the condition of schizophrenic like symptoms. So we can say that certain pathological condition also included in the dementia, and this dementia is a part of depression as well as the schizophrenia. Now we have suffered from the lockdown situation since March 2020 because of the COVID-19 disorder. So friend, you will see that we never thought that this type of social life we will face. And that created by the COVID-19 for, we can say, last near about 18 months, we are facing this situation. That condition, quarantine and self-isolation. Quarantine and self-isolation means you have not to come in the contact of the family members. Even sometime the patient is COVID-19 positive, so that family member also isolated from its family own. अपनी ही फैमिली से उसको अलग कर दिया गया, एक रूम में बिठा दिया गया. ऐसी सिचुएशन भी हमको कोविड-19 में देखने को मिली. So quarantine and self isolation can most likely cause a negative impact on one's mental health. So now see, if the person having the social life, if the person having the social effect, person having the social affection, so if that fellow is isolated for 15 days or 1 month or 2 months continuously, so what will be the impact on that fellow? Now, if you are not able to come out from the house, if you are not able to meet your friend circle, if you are not able to coming into the market for a complete year, so what will be the effect? So dramatically, the lifestyle during the COVID-19 has been changed, and that lifestyle is not expected anytime. हमने कभी सोचा ही नहीं था कि हमको ऐसी जिंदगी भी जीनी पड़ेगी कि हम सोसाइटी से कट जाएंगे, कि हम एक दूसरे को घर पे नहीं बुलाएंगे, हम किसी के घर पे नहीं जाएंगे, हम किसी को अपने पास नहीं बैठने देंगे. So that condition is creating a mental disorder, because generation to generation we are having the genetic disorder, we are genetic code that we are a social animal. Without society we cannot imagine to live. And suddenly if the isolation is imposed on ourselves, then it creates a mental disturbances. So the separation from loved one, अपने ही लोगों के साथ हम लोग नहीं मिल सकते, लॉस ऑफ फ्रीडम, बंद कर दिया गया घरों के अंदर, अनसर्टेनिटी, यही पता नहीं है कि हमको ये कितने दिन तक रहना है, कैन कॉज अ डिटर्मिनेशन द इंडिविजुअल्स मेंटल हेल्थ स्टेट. चिल्ड्रन टीन एट रिस्क, सबसे ज्यादा जो प्रभाव पड़ा वो पड़ा बच्चों पर और टीनेजर पर. एल्डर्स एंड पीपल्स विद डिसेबिलिटी एट रिस्क. अब जो बुजुर्ग लोग हैं जो कहीं बाहर जाना चाहते हैं, जिनको सपोर्ट की जरूरत है, और दो पर्सन विद हैविंग द डिसेबिलिटीज, हेल्थ वर्कर एट रिस्क, ये सबसे ज्यादा प्रभावित हुए. एक तो दूसरे एक कम्युनिटी को वी आर सेपरेटिंग, वी आर क्वारंटाइन, वी आर आइसोलेटिंग, वी आर डूइंग द लॉकडाउन ऑफ द कम्युनिटी. दैट कम्युनिटी विल नॉट कम इन द कॉन्टेक्ट, वी हैव टू मेंटेन द सोशल डिस्टेंसिंग. एंड ऑन द अदर हैंड द हेल्थ वर्कर आर वर्किंग इन द हॉस्पिटल वेयर आर रेगुलरली दे आर बीइंग एक्सपोज्ड टू द COVID-19 infection. So see what may be the mental condition of these health worker, because since the morning to the evening they are at risk and they are bringing this infections to the home. So what is the condition of health worker in that condition? Stigmatization means what? स्टिग्मा हम बोलेंगे कि ये एक तरह का, बोलते ना, जिंदगी के नाम पे धब्बा लग गया. That sometime fearfully or without any reason somewhere we imagine certain things. जैसे COVID-19 नहीं है, फिर भी आदमी कोई हॉस्पिटल से दूर रहे, मेरे पास नहीं आना. So that is a stigma. मीन्स एक बार किसी को कोविड हो गया तो उसकी शमशान यात्रा में भी 3 लोग जाने को तैयार नहीं है. दैट इज अ स्टिग्मा, दैट इज आइसोलेशन. नाउ यू जस्ट इमेजिन द सिचुएशन कि जहां शमशान यात्रा में 150, 200, 300 लोग जाते थे, आज उस व्यक्ति को 4 कंधों की जरूरत है और वो 4 कंधे भी उसको नहीं मिल रहे हैं, वो गाड़ी पे जा रहा है बेचारा. सो दैट इज द स्टिग्मा. क्या बिकॉज भाई मर गया आदमी, उसके अंदर काय का कोविड, उसके अंदर तो कोई वायरस है ही नहीं, इनएक्टिव वायरस है, अब उसको तो इन्फेक्शन होना नहीं. लेकिन इवन देन द पर्सन आर maintaining the distance, person are not willing to go over there, person are not willing to go to that family. That is the stigma. Now how the children and teen at risk? Children away from their school, सबसे बड़ी मुसीबत तो ये है, 7-8 घंटे के लिए स्कूल रहते थे. There was 6 to 7 hours where there was the condition of school or colleges. That school or colleges has been stopped. The teenagers have to be at home. Staying at home can have many questions about the outbreak of the look towards their parents or caregivers and give answer. No, not all children and parents respond to stress in the same way. घर में एक नई मुसीबत, घर में खुद स्ट्रेस है, बच्चे अपने स्ट्रेस में हैं, बच्चे कुछ पूछना चाहें, आंसर नहीं मिल रहा है, आंसर मिल रहा है तो पता नहीं कैसा मिल रहा है. Kids can experience anxiety, distress, social isolation, abusive environment. Abusive environment means घर में है, घर में सवेरे से शाम तक if the child will be present at the home, definitely the parents are getting irritated. Though irritation is not a normal thing, it is again come in the category of mental disorder. But parents do not understand that they themselves are suffering from the mental disorder. And in that condition, they are abusing the child. They are abusing the teenagers. Social isolation, they are not able to meet with the friend circle. They are not able to enjoy the outside of the home. So these are the condition of children and teenage which are at risk. Now see, excessive crying, annoying behavior, increased sadness, depression or worry, difficulties with concentration, attention, changing or avoiding activities that they enjoyed in the past, unexpected, है ना? Headaches, pain throughout their body, change in the eating habits, all these things. Now you will see entire lifestyle has changed. Means there is no routine in the eating, there is no routine in the sleeping, there is no routine in the enjoying. Children has forgotten to go outside, children has forgotten to enjoy with the friend circle for the physical activities. All these things has been stopped because person has been isolated for these 18 months in the COVID-19, and they are suffering, a whole family is suffering from the mental disorder or mental stress, we can say. To help offset negative behavior require parents to remain calm. It is quite impossible. पेरेंट्स के लिए सवेरे से शाम तक 24 घंटे बच्चा घर पे रहेगा तो कैसे काम रहेंगे? तो सबसे पहले शुरुआत मेंटल डिसऑर्डर की यहाँ से होती है कि पेरेंट्स कैन नॉट बी काम टू थ्रू आउट द डे, डील विद द सिचुएशंस वाइजली एंड आंसर ऑल द चाइल्ड क्वेश्चन फॉर द बेस्ट ऑफ देयर एबिलिटीज. That should be done. That should be done. That is the responsibility of the parents. But most of the parents are failure in this part. Parents can take some time to talk to their children about the COVID-19 outbreak and share some positive fact, figure, and information. Most of the parents are not interested. Most of the parents are causing the fear to the child. They are explaining in such a way that child becomes the fearful about the COVID-19, but they are not giving the exact information. They are not counseling the child. They are not answering the child. They are not getting the correct information or not giving the correct information to the child. Therefore, the atmosphere of the home becoming the stressful. Parents can help to reassure them that they are safe at home. Encourage them to engage some healthy activities, including indoor sports and some physical and mental exercise. Of indoor activity, most of the child are stuck to the electronic media. Along with that, the parent should help the child for the physical activity also at home. But nowadays it is becoming difficult, and you will see that parents themselves are not involved in that. And because of that, the stressful atmosphere at the home is being created. Parents can also develop a home schedule. We should develop children to keep up with their studies. Parents should slow the less stress or anxiety to their home, and children perceive the feel negative energy from their parents. Means the summary is that parents may create a happy atmosphere at home for the children. In that condition, the child may be prevented from affecting the mental condition at the COVID-19 situation. Elders and people with disabilities are risk. Elderly people are more prone to COVID-19 outbreak due to the both clinical and social reasons, such as have weaker immune system or other underlying health conditions. Now you see, the elder people, because of certain things having the low immunity, and because of the weaker immunity, the infections is more. Infection is more common with the elder persons, and because of that, according to mental expert, people age 60 or above are more likely to get the SARS-CoV-2 and can develop a serious and life-threatening conditions even if they are of good health. Means most of the time you have seen in the COVID-19 that the person over the 60 year of age are more sufferer or more suffering with more complications, we can say. Now, physical distancing due to the COVID-19 outbreak can have negative effect on the mental health of the elderly and disabled individuals. That is the big problem. That social distancing is that factor which created the stress in most of the person. Social distancing means what? Social distancing, initially, it was found that 1 meter social distancing is sufficient. उसके बाद पता चला कि 2 मीटर की सोशल डिस्टेंसिंग रखनी है. उसके बाद पता चला कि सोशल डिस्टेंसिंग रखनी है, मास्क लगाओ, हाथ मत मिलाओ, कहीं जाओ मत, किसी को बैठने मत दो, आसपास में बैठो मत. So these are the condition was creating. So definitely whatever the social combination, whatever the social bonding was there with the individual to individual, that social bonding was disturbed. That social attachment has been affected with the COVID-19 isolation or physical distancing. That is also causing the mental stress to the individual. We have seen physical isolation at home among the families. That is the bigger problem in the COVID-19, that isolation, physically isolated person. Physically means what? Not the mentally. Physically means nobody will come at your home. You will not go to others' home. You will not meet anybody. So these are the conditions that physical isolation causing the irritation at home. We can say in case of anxiety distress, it include traumatic situations for the elderly people depending on young one for their daily needs, and self-isolation can critically damage a family system. Now you see, if somebody having the old age factor and because of the infection, he has been isolated in a room and nobody is going to their room to help them. And that person need every time youngsters help for their daily routine, but because of the physical isolation, that help is not available. So because of that, they are getting injured. मान लो कोई बुजुर्ग है, वो किसी रूम में आइसोलेट किए हुए, वो स्लिप हो गए, फ्रैक्चर हो गया, तो इस तरह की फिजिकल इंजरी भी इन लोगों को ही द एल्डरली एंड डिसेबल्ड पीपल लिविंग इन द नर्सिंग होम कैन फेस एक्सट्रीम मेंटल हेल्थ इशू. घर का कोई आदमी नहीं है, नो फैमिली मेंबर्स आर अवेलेबल एट द हॉस्पिटल, ओनली द नर्सिंग persons are available. Because of that, the person having the depression, person having the mental disorder, anxiety. So these are the conditions. However, something as simple as phone calls during the pandemic outbreak help to console everybody. At that time, we should communicate. We should not completely isolate that person. We should be in touch to that fellow. That will minimize the anxiety level, minimize the level of depression, minimize the level of stress. So we can say that stress, that isolation step may be minimized with the communication by the phone. So माने these are the things. हम देखेंगे कि इस तरह की चीजों में हमारा कम्युनिकेशन काफी लेवल तक इस स्ट्रेस को कम कर देता है, मेंटल कंडीशन को कम कर देता है. Now you see, family members may witness any of the following changes in the behavior: irritation and shouting behavior. ये चीजें ऐसी हैं जो हमको मेंटली प्रॉब्लम में देती हैं. माने इरिटेशन एंड शाउटिंग बिहेवियर मस्ट बी कंट्रोल्ड. चेंज इन द स्लीपिंग एंड ईटिंग हैबिट्स, जो चेंज हो गया है, माने हमारे खाने का कोई टाइम नहीं रहा इन द कोविड-19. ऑल द ईटिंग हैबिट्स हैज बीन चेंज्ड, दैट शुड बी इन रूटीन. Sleeping habit has been changed, that should be in routine. Emotional outbursts, that should be prevented. Means we should not be over irritable, we should not be over anxious, we should not be over shouting. So that must be considered if we want to avoid the mental disorders. That is the bigger problem in the COVID-19, that health worker, doctor, nurses and paramedical staff working in the front line in the COVID-19, these are at the maximum risk. And because of the risk, anxiety about the infection is also found in the health worker. And because of that, if you will see, you will find that sometimes so many health workers are avoiding to go on the working place. बहुत सारे लोग ऐसे हैं हेल्थ वर्कर में जो रिस्क की वजह से उस जगह पे जाना नहीं चाहते, जो काम को अवॉइड करना चाहते हैं, जो घर से या तो घर से अवॉइड रहना चाहते हैं या हॉस्पिटल को अवॉइड करना चाहते हैं. सो दैट इज द कंडीशन. सोशल डिस्टेंसिंग, आइसोलेशन फ्रॉम देयर फैमिली एंड फ्रेंड्स एंड द सीरियस सिचुएशन ऑफ देयर पेशेंट may take a negative toll to the mental health of the health worker. The working efficiency of health professional may decrease. अब अगर इस तरह से हेल्थ वर्कर को एंजाइटी, डिप्रेशन और वी के वरीड रहेंगे, दैट क्वाइट नेचुरली देयर परफॉर्मेंस, देयर जो है ना ड्यूटीज विल बी अफेक्टेड एंड वट एवर द आउटपुट इज नीडेड दैट विल नॉट बी प्रेजेंट. Means health worker are avoiding, health worker are anxious, health worker having the fear of infections, therefore the output or working efficiency of health worker are affected. Now mental health, now see, fear of catching the disease. The first factor is the health worker having the fear, because they are regularly exposed, though they are using the prevention, though they are using the protocol of the COVID-19, even then they are having the fear of catching the disease. Long working hours, and that fear is because of the long working hours, because repeatedly they are being exposed, repeatedly they are facing the situations. Long working hour causes the physical or mental exhaustion to them. Death of their colleagues after exposure to COVID-19, that is a situation which can be imagined, that some health worker are working together somewhere, and out of that, if somebody has died because of the COVID-19 infection, so what will be the situation of that health worker who has seen the death of the colleague? working over there. That will cause a fear, unwanted fear, that will cause unwanted delaying, that will cause unwanted avoiding the working, and ultimately that will cause the anxiety level, and output of the working will be affected. Unavailability of effective COVID-19 medication. Though the infection of other diseases are also common, but we are not afraid of other diseases because the proper or effective treatment is available. But even today, we cannot firmly say that we have the COVID-19 treatment, and that specific treatment will definitely treat the 100% COVID patient. Even today, we are in the experimental phase that which medicine is most effective. Patient load, that is again a condition, unavailability of protective gears, because we do not know what are the mode of infections. कितने मोड ऑफ इन्फेक्शन हमें यही नहीं पता. ठीक, हमने मास्क लगा लिया, पीपी किट ले ली, बट इवन दो वी डू नॉट नो हाउ मेनी मोड ऑफ इन्फेक्शन. Somewhere it is a droplet infection, somewhere airborne, somewhere waterborne. So how many things, at what places we have to take the prevention. So these are the conditions how the mental health of the health worker is being affected. Now the stigmatization, as we have discussed, the general people recently released from quarantine can experience stigmatization and develop a mix of emotions. Once you have the COVID-19 patient, you have a stigma. All of the family members, all of the mohalla members, whole of the society to whom you belong or you know, they will afraid with you. आपसे डरे हुए रहेंगे, आपके कांटेक्ट में नहीं आना चाहते, आपसे बात नहीं करना चाहते, आपके घर नहीं आना चाहते, आपसे मिलना नहीं चाहते. So that is the stigmatization. So that situation is present everywhere in the COVID-19 situation. Health worker trying to save lives and protect society may also experience social distancing, change in the behavior of family members, and stigmatization of being suspected of carrying COVID-19, which we have told that stigma is a unwanted fear, unreasonable fear, though the person is fully protected, but even then the person are suspecting that this fellow, this health worker may be carrier. So that is a stigma. Previously infected individual and health professionals may develop sadness, anger, or frustration because friends and loved one may have unfounded fear of contracting the disease from contact with them. माने ठीक होने के बाद भी लोगों के दिमाग में ये है कि ये आदमी के कांटेक्ट में आते ही हमको बीमारी हो जाएगी, बिकॉज ऑफ दैट पर्सन डेवलप द सैडनेस, पर्सन डेवलपिंग द एंजाइटी, पर्सन डेवलपिंग द एंगर और फ्रस्ट्रेशन. सो नाउ द नेगेटिव इफेक्ट ऑफ टेक्नोलॉजी. सबसे बड़ी बात, नथिंग टू से, ओनली दिस इमेज itself explaining the factors during the COVID-19, that how this technology has negatively affected us. No physical activities, no friend circle, no family member entertainment, no physical activity, even at home. Persons are stuck to the technology, stuck to the electronic media, and all the factors has been changed. Whatever the factor were present in the school or college life, that are not present here. So now this image is sufficient to say these are the common things which we have observed. Sleep disorder. There was no routine. Your body needs a routine in every work, whether it is a sleep or eating or whatever else. But now, because of the COVID, sleep disorder, sleep routine has been changed. Physical inactivity, person at home, person at isolated, person in the quarantine, have no physical activity, wastage of precious time, lack of real connections. Now these are the figures. 71% of smartphone owners keep their phone next to their bed at night to ensure they do not miss a thing. रात को 2-2, 3-3 बजे तक फोन पे लगे रहना. स्लीप डिसऑर्डर, Another study found that over 40% of the bedside smartphone user wake up from noise or lighting from notification coming from their devices. फोन के नोटिफिकेशन, फोन की लाइट, इनसे स्लीप डिस्टर्ब होते रहती है. इनको लोग दूर रखते नहीं. It might be seem like a harmless habit, but late night technology use can interfere with your ability to sleep. Physical inactivity, we have discussed. Lack of real connections, we have discussed. Now the mental health. That is the condition, the dimension of the wellness, environment, emotion, intellect, physical, social, and spiritual. These are the conditions, these are the components. Means environment should be healthy, environment should be free of pollution, emotions should be healthy, we should maintain the emotion. Intellectually, we should analyze. Unnecessary, we should not be frustrated. Unnecessary, we should not be sad. Unnecessary, we should not be irritable. Physical activity must be sufficient for the mental health. For the mental health also, physical activities or physical well-being is needed. Society is a good tool to avoid the mental health. If we are in the contact of society, if we are involved in the social activities, quite possible that we will not suffer from mental disorder. Now the spiritual, it is a big ground, it is a big support, because spiritualism gives you the extra support, extra strength, extra positive thinking regarding yourself. So these are the component of health, that how can you maintain your mental health even as the physical health. Now you see, environment means what? Environment means social environment or the nature, both. Nature should be pollution free, society should be healthy, means person should not be a poor one. Poor means what? Whatever the need, and if the individual is unable to fulfill that need, that is called poverty. Crime means what? Crime means such type of activities which are not appreciated by the society, these are called a crime. Environmental racism. Now, how emotion affects? Depression, anxiety, stress, poor body image, grief, loss of major changes in your life, such as the becoming a new parents, can all affect your mental health. Depression, anxiety, stress, unnecessary stressness, unnecessary anxiety, change in the lifestyle, these all are causing the emotional changes. Sadness, anxiety, depression, when good mental health, feel we can cope with or respond positive to life. That is important. Means negativity should not be there always. We should think about the positivity. We should respond in a positive way. We should be positive in the relationship. We should be positive in the activities, and we should be positive in our surroundings and community. That is called a social behavior, like physical health, perspective and experience in the chain. This can be in the shorter or longer terms. You may find that sometimes you can manage whatever life hand you other days even a simplest things feels overwhelming. So these are the mental health and physical health are component or complementary to each other, we can say. How intellectual disabilities affect mental health? Intellectual disability means a significant reduced ability to understand new or complex information and to learn and apply new skill. Means what? It means if suddenly there is a change in the need, suddenly change in the behavior, suddenly change in the procedure at that time, because we do not have the information, so we want to follow the same old routine. That is the condition. And in this way, this will affect the mental health. For example, in the lockdown, most commonly the new teaching method has been developed. So at the institutional level, most of the teachers are suffering from that type of trouble. They are mostly getting the irritated because how this online classes are possible, yeah? How to prepare the PPT and how to communicate to the students, because the students are sleeping after connection to the online classes. So these are the situations, but we have to handle these with positively. We have to change ourselves. We have to change our ability. We have to change our productivity according to the new need. That will prevent from our mental disorder or mental, we can say the deviation from the normal condition. Provide support to all persons who experience both mental health condition and intellect disability can be complex. Now, some factors affect mental health. अब भाई कौन सी चीजें हैं, how this mental health can be affected? What are the factors which can change our mental health? One is the antisocial attitude. Definitely, antisocial attitude will change your mental condition, will make you more sufferer. Antisocial personality pattern, antisocial friend and peers. मतलब हमारे तरफ जितना एंटी सोशल एनवायरमेंट बनेगा, हमारा माइंड उतना ही ज्यादा नॉर्मल से हटता चला जाएगा एंड वी विल बी मेंटली इल. Substance abuse, family and marital factors, the good important, lack of pro-social leisure activities, poor employment history, lack of education. Means all these factors, if you will see somewhere, because mental environment requires the proper analysis and proper assessment, and all these factors are belonging, that antisocial activities are never accepted, that will deviate from you from the society. Lack of education will not be make you able to analyze the fact in proper way. Poor employment history, that will affect you mentally, that will give you the instability. Lack of pro-social leisure activities, that also means we can say whatever the factors are deviated from the normal situation, all that factor will affect your mental condition. Now the spiritual factors affects mental health. Now the spirit means what? Now we can say the भाई अध्यात्म है, लोग आध्यात्मिक रूप से देखे जा रहे हैं. Variety of spiritual belief and customs are varied. People who practice them. The religion, the spiritualism, the supernatural theory, or we can say such type of thinking. Definitely, these are give the extra strength to the person. We can say that spirituality and religion are not the same. How? Religion people follow a particular faith. We can say religion is a pattern of lifestyle. We can say religion is a pattern of lifestyle, whereas spiritually is a level of thoughts, level of assessment, level of decision at the level of mind or spirit, we can say. So these are the emotions, how to tackle these emotions, how to tackle these conditions, which is giving an extra strength to them. And we can very easily avoid these mental disorder with these two things, because these are the two tools, religion and spirituality, that give an extra attention to the individual to avoid so many disorders in the society or in individual along with the family members also. Now you see positive impact of spirituality, you may experience better confidence, self-esteem and self-control. It can help you sense your experience in life. When unwell, it can help you feel inner strength. So these are the factors you will see that basically at the level of self-confidence, the spiritualism work. अब stress management, stress तो आएगा. At the workplace, at the family, at the society, we have the stress. So how to manage this stress? Meditate करें, nature से जुड़ें. We should connect with the nature. We should practice with the meditation. We should do the physical exercise. We should do the work with time bound. We should enjoy the music. We should laugh. We should have a hobby which give us happy. Go for a walk, connect with nature, listen to soothing music. So now these are the condition that music सुनिए, हंसिए. हंसना एक बहुत अच्छी दवा है. आज क्या बनाओ? हस्बैंड बोले देख लो यदि कोरोना की दवाई वैक्सीन बन जाए तो बना लो, है ना? तो हंसना भी अपने आप में एक दवाई है. connect with friends. The friendship is the medicine of so many disorders, we can say, because it reduces the stress, it reduces the tension, and you will surprise that so many solutions can be found with the friendship discussion. So many solutions can be found. So connect with the friends. These are the good tools to tackle with the stress. Avoid procrastination, है ना. Now change. आप कभी भी किसी भी चीज को अवॉइड मत करिए, डिले मत करिए, भाई जो करना है सो करो. प्रोक्रेस्टिनेशन का मतलब ये हुआ है कि किसी भी चीज के बारे में आप टाल मटोल करना बंद करिए, जो काम करना है सो करिए, तुरंत निपटा डालिए उसको. सो दैट सिचुएशन विल मेक यू फ्री, दैट सिचुएशन मेक यू कॉन्फिडेंट, दैट सिचुएशन मेक यू अवे फ्रॉम अननेसेसरी एंजाइटी. Mindfulness and meditation. Paying attention to daily life and things we typically rush through. That is the mindfulness. A mini mindfulness meditation exercise that you can do anytime, anywhere to help calm down in just a few seconds. Meditation is a good tool to calm down because all the stresses can be avoided for certain time. And if this practice increases, this meditation definitely will help you to come out from the stress or depression. If you are doing the regular meditation, practice abdominal breathing. That is a practice of breathing, respiration, we can say, also called in old age language, that is a pranayam. So that pranayam help you to maintain your body oxygen level, to normalize your body functions, to detoxification of your body. So definitely you will have more healthy condition at the level of physique and mind. So that is the abdominal breathing, you know all. So now that is the type of respiration, you know. Serve other, इससे बढ़िया ज्यादा खुशी हमको कहीं नहीं मिलती. If we are doing the service to others, that gives you an extreme pleasure. So that is the condition about the mental health, we can say. So friends, that is the most important part, how to tackle, how to handle, how to identify the mental condition in our daily routine, even in the institutional ground at the working place. So I think it will have been more than sufficient for you. And you nicely hear me. For that, I am very thankful to you, thankful to organizer that they give me an opportunity to interact with all you learned persons of all over the country. Thanks the AICT to permit us to organize this program. And thanks the coordinator to give this particular time. Thank the comparer Ankita and Suman for their nice conducting of this program. Thank you.
Thank you so much, sir, for sharing your valuable knowledge on mental health and stress management. You have shared such an informative knowledge with us. Knowledge with us on mental health and stress management. As mental health plays a very important role in our life, all of us ignores our mental health, but as you said, how important is this for us to maintain it? Thank you so much, sir, for this lovely session. If anybody wants to ask any query, then please drop your question in the chat box.
There is a question, how to recognize a person having the depression or anxiety. Sometimes people behave differently just because of their sad. How to distinguish between them? That is a time being that depend upon the situation. In normal time, person because of certain factors may behave in this way, but that is not a condition of sadness or anxiety. Anxiety is a disease which is a persisting condition, or depression is a condition, mental illness which is a persisting in condition. If we are seeing that person persistingly behaving in this way, then we come to a conclusion the patient might have the anxiety or depression. But if it is a some way, even I can be irritable, even somebody else can be irritable, but it does not mean that person is the anxious or having the disorder of anxiety. So if occasionally person having that, maybe because of time being situation that may cause the change in the behavior, it does not mean that person is sick. Depression or anxiety, if the person is having the disorder, then continuous change in the behavior will be found.
Anybody else wants to ask anything? Sham. Mr. Sham. Mr. Sham is asking how to motivate ourselves in everyday life.
Self motivation with positive thinking. Self motivation is done by the positive thinking. We should know that we can do this thing, and we should determine that we have to finish this thing. The motivation is only can be with the planned work. If we do not have the planned work, then we cannot motivate ourselves. दूसरी चीज ये है कि प्लान हम करेंगे तो वो हमारा टास्क कंप्लीट होगा, कंप्लीट होने के बाद हमको सेल्फ मोटिवेशन शुरू हो जाती है कि नाउ वी कैन डू दिस थिंग। अगर हम उस चीज को टालते रहेंगे तो कभी पूरा भी नहीं होगा और हमारे अंदर एक नेगेटिविटी फैलती जाएगी। सो इफ यू वांट टू मोटिवेट योरसेल्फ, ट्राई टू फिनिश द वर्क within time stipulated time, or whatever the time factor has been given to you, whatever the task has been given to you, finish that task within that particular time. That is a good thing. Now, how to maintain mental health during pandemic? By discussion and avoiding the rumors को अवॉइड करना है, और घर पे हमने फैमिली के साथ इलेक्ट्रॉनिक मीडिया के बजाय फैमिली के साथ कुछ टाइम स्पेयर करना है, जिससे हम लोगों को एंजाइटी से अवे सिर्फ हमने अपनी पर्सनल चीजें हैं उनके साथ एंजॉय करिए, आप उनके साथ गेम्स खेलिए, बिजी रहिए। दूसरा, जो हमारे एंटरटेनमेंट वाले सीरियल हैं, कॉमेडी सीरियल देखिए, अगर देखना ही है तो सब लोग साथ बैठिए। तो इस तरह की कुछ चीजें हैं जिनसे हमको एंजाइटी से दूर रहना पड़ेगा, तो इस तरह के काम हमको कुछ करने पड़ेंगे। How does gossip in the office? During the working hour, we should not do the gossip. Now, for the gossip, we have a loop period. In that, we should do only this thing. And if you want to avoid your friends doing the gossip, provide them work, give them work, and give them time-bound completion task that you have to complete this particular task within this particular time. Then the gossip will be automatically avoided.
Any more questions? I think we are done with the queries. Thank you, sir, for such an knowledgeable and interactive session. Now there is a small break. Please join at 12:10 p.m. for the further session. Thank you.
Thank you.
There is some delay for next session. Please have patience. We will update you shortly. Thank you. Welcome back. Sorry for the inconvenience and delay in the next session. Now, I would like to welcome Professor M. Madhusudan. He is a true academician and a researcher. Having high academic credentials, 145 publications and highest citations, 1464 plus GS citations, 16 plus H-index articles and 24 plus I-index articles. He has implemented 4-year undergraduate program for the first time in India. His remarkable achievement includes designing job-oriented courses as add-on courses in the College of University of Delhi, imparting skill training in the College of University of Delhi as a part of UG program and other curriculum with landmark MOUs with National Skill Development Corporation, Delhi. He was an expert member of Indian delegations in designing electronic gaming courses under UK India Educational and Research Initiative in collaboration with West College, Scotland, UK. He has lifetime membership of several professional bodies. He has achieved many awards. I would like to welcome Professor M. Madhusudan sir. Please join us, sir.
Thank you very much, madam.
Thank you, sir.
Okay. So shall I continue?
Yes, sir.
Is it PPT visible and my voice is audible?
So your voice is clear, but PPT is not showing.
1 minute. Now, madam? Now showing?
Yes, sir. Now it is visible.
Shall I start, madam?
Yes, sir. Sure.
Good afternoon, friends. Once again, I will discuss another very important topic, that is referencing in research and web-based citation tools. This is very, very important as far as the research is concerned. You are in the process of writing a book. You are in the process of publishing a research paper. You are in the process of publishing a chapter. You are in the process of completion of your submission of your PhD thesis or MPhil dissertation or any other research project reports. So this is the the component of your research work, that is the reference in the case of articles, bibliography in the case of the MPhil dissertation or PhD thesis. So let me discuss first the part that is first referencing. The later portion, I will give you very interactive demonstration of some of the free web-based citation tools. You really like it. Even if you do not have any knowledge about any citation style, you will definitely create your bibliography without any tension, without any wasting of your valuable time. That is my basic purpose of this lecture. So first, what is the purpose of referencing? Referencing means you are aware It is a very crucial part. Yes. Hello, madam. I will call you later in the lecture. Referencing is very important part. It is for successful academic writing. As you know very well, as we are practicing very much as part of our academic research papers, projects, dissertations, and so much. So, what is basically reference? It is basically nothing but is a method of acknowledging, and also if we are taking somebody's help, maybe any research work, without others the contribution, we may not fulfill, we may not complete. This you know very well. So, for example, if you see the MPhil dissertation or PhD thesis, there is a chapter called research methodology, that is a review of literature. So where we are studying, so reviewing so much literature related to our topic, and that is based on that only we are proposing a topic for our research, because there is no duplication, nobody has done, that's why I'm doing. So for justification you are giving. So that is very important. And in the other chapters too, we used to cite many times in text also. Okay, so for acknowledging, suppose if it is not our content, we are borrowed from others authors or others works, so it is our moral duty as far as the plagiarism is concerned, or as far as the research ethics are concerned, we must and should acknowledge. So when we are giving acknowledgement, so that is a method of acknowledgement is called a reference. So this will help basically, that is somebody's innovative, creative work, how it is used in your research work, and how the research ideas and research findings and support to your study. So that's why referencing is a standardized method of acknowledging all sources of information. Means may be printed, may be electronical. So means may be article, may be book, may be website, may be anything. Okay, maybe newspaper, maybe so many and so forth. So that's why in that, what kind of sources? Maybe data you are taking, maybe you are taking sometimes ideas. So many a times maybe you are aware, so maybe somebody already taught about the plagiarism. So the plagiarism basically, it is this is also even if you are taken somebody's content and putting in your work and claiming yourself, means that's a plagiarize. If you are giving acknowledgement, it is a not plagiarize. So even the ideas also, if you are taken, so that is not coming directly in the references, but it should come in the bibliography. So this is also part and parcel of plagiarism. Later we will discuss. So this is basically, you will see acknowledge this kind of referencing. We will see in academic writings like article, writing a book, writing thesis, dissertations, and so forth. So just and what is the basic purpose of referencing? Why we should give referencing? Why should we follow? When you are publishing a particular article to any international journal, so they have, every journal, they have their own standard, referencing standard. So that whether you are good in that standard, whether you are not good in that standard, but you have to provide all your references according to their prescribed standard. So that's why it is a very important. So one should not have the knowledge in all standards. So what are there, that I will discuss later. Let me the first the purposes of the reference. It has become, because it is a basically necessary element for academic writing. So this will clearly shows. So if it is an article of consisting of 5 pages, so how much your contribution, how much you are borrowed from others' work, and how others' work impacted on your work. So that's why it is an element of the academic writing. And it is used to, the second purpose is when you are citing only little bit you are taken, but somebody, those who are reading your article or your chapter or book, if they wish to enhance their further knowledge, they have to go for that particular source. So this referencing basically helps to locate original source of work so that everyone may access that material and understand it is or her own way. Because when we are using a particular work of others, maybe we are using a single line, maybe one paragraph, or maybe two paragraphs. But if our users, those are very much interested to read further about that particular context and particular information further, so this will help you to that. The third one, very important. See, the plagiarism, many a times you are struggling. Okay, maybe in service also, or as a student, research scholar also, you are struggled very much. And nowadays, it is a very important and plays a vital role in academic writings and promotions too. So to discourage plagiarism, so this is the very important. One of the major reasons for the plagiarism is their poor knowledge about referencing styles. So, and if they are not good in referencing style, that's why they will remove double quotes and they will remove references. So automatically when they are checking their content in the anti-plagiarism tools, whether it maybe Turnitin, maybe Urkund, or maybe any other software, it will catch hold. To avoid that the plagiarism, this is the one should be good in referencing. So that's why it will give credit to these scholars for their efforts in growth and knowledge. Coming to the question, it is coming from your brain and maybe it is citing why we should cite sources. What if we are citing, what are the benefits? Okay, so as a faculty member, as an author, you can see these citations are basically very beneficial to anyone who wants to find out more about your ideas and where they came from. So if they want to understand like this, so this is a very beneficial, so they can go for. So if they are reading your work, research, the users will understand what are your ideas, maybe through experience, maybe you are borrowed from other works, how you are presented your ideas. So this is a very clear indication, and where it is coming from. So this is a very important, because it's not mandatory everything we have to write our own, but we can take those are in the related area, those are worked, and our predecessors in that area, we can take there, but we must and should cite. That is a very important. So that's why, so in this case, what happens here, wherever you are putting double quotes in text, in your writings, maybe in the article, maybe chapter, maybe thesis, so whoever reads that one, they came to know what is your ideas and what are you are borrowed from others. Because of they will identify with the help of this citation. Number one. Number two, not all sources are good or maybe right, but sometimes your thoughts may be more accurate or maybe those of your sources. Sometimes what happens this one, sometimes why the sources, sometimes when we are taking some portion of content from other works, they do have some problems, maybe grammatical mistakes are there, or sometimes maybe it is a so hi-fi language it is written, so it is very difficult. So that is the case. What happens as a author, we are paraphrasing some of the good words to easily understand the content to users or readers. So that's why. So this is sometimes the sources are good or not, but your thoughts it is highlighting. So you are making paraphrasing, but of course you are giving citation, and the proper citation basically keep you from taking the rap for somebody else's bad ideas. This is very important, because sometimes what happens here, knowingly, unknowingly, or wantedly, unwantedly. Sometimes you are they forced to take somebody's citations, but sometimes what happens according to some according to some situation, according to some studies, according to the available information. So sometimes the citations may be it is in a dangerous in nature. If you are not putting that content is in the dangerous, okay. So that is the case. What happens here? If you are putting double quotes and citing, so if anything goes wrong later part, so you are not responsible because you are borrowed, because something goes wrong on the original, so it is the original author is responsible. That's why. So there is no, if any bad ideas are there, you are not responsible. And citing all sources shows the amount of research you have done. So this is where it is a very important. I will focus you. I don't know about your knowledge, but with my the 22 years of experience in various capacities, and I have done a lot of good research also, but being a reviewer of many international allied journals and Indian journals, and referee of so many theses and research projects of ICSR, UGC, and so on and so forth. So I have a lot of whenever this particular article you are sending for publication in international journals. So one of the important aspect is the first and foremost is the plagiarism. The followed by the how it is rating your journal, your article, how it is. So normally what happens here, the moment it is cleared from plagiarism, so then it goes to the last part, that's the references. How many you are cited? This is one of the more cite, the more value. And at the same time, the lesser site also having more value. So if it is a more value, more citing, more value means, so suppose a particular the topic which has been undertaken by so many research scholars and so much research has been done. So that is the case, you will find so many articles. For example, use of e-resources by research scholars. So many articles, use of internet, use of social networking sites, so many articles you will find. But this is the case, you have to cite more and more, and the latest ones. But at the same time, suppose if you are designing a particular system, a new system, developing a particular system, database or system. So naturally what happens here, you will find very less the articles or the studies in that area. So doesn't mean that one, if a more having a particular article having more references means a high valued, means a less means less valued, no. But this is the case varies. If it is a general study, so that is a survey based, okay, normally having more. But it's a design based studies, evaluation based studies, particularly sciences, having very less. So even if you are not finding much, so it means here it is a so value to your work because you are the pioneer in that particular area of research. So that we'll discuss later. But citing sources basically strengthens your work by lending outside support to your ideas. So that's why we must and should cite the sources. So what actually need to cite as the sources, particularly when it is a very important you have to cite. A citation is nothing but, as I mentioned, it is a credit or a reference to another document. In simple words, means if we are taken a few words or few lines or few paragraphs, we must and should give credit to that particular author or authors. Okay, so this author may be sometimes the a personal author, individual author, maybe sometimes institutional author too. Whatever may be, we have to give. So for our safer side, something goes wrong later, so we are not responsible. And it is not curtailed. You can take as much as from any source which is relevant to your studies according to the purpose and nature. So whenever you borrow words or ideas, you need to acknowledge their sources. Very important. How you have to acknowledge these sources? First, any piece of information, maybe it is the text, maybe figures, maybe figure, maybe table, maybe anything. It must and should be a start double quotes. Okay, the starting that you have to put double quotes, and where it is ends you have to close with the double quotes, followed by that the author and year according to the style. That later portion will discuss. Okay, and sometimes even you are not taken as it is, but you are changed some words and you are paraphrased. Paraphrase means rewording something written or spoken by someone else or maybe somebody. So you are writing the same words, same particular author's work lines. You are reproducing with your own words. That is called a simple paraphrase. Even that is the case also, because the meaning is same but wording is different. But this is also part and parcel of plagiarism. That's why you must and should you put, even if it is a paraphrase also, you must and should cite. And whenever the another instances, whenever you are taking statistics part of your research, for example, the population of India, literacy rate of India, or particular area, literacy rate in Agra, literacy rate of Uttar Pradesh. Okay, so that is the case. What happens here? Our research, we are using the statistics from government sources, because the valuable, accurate statistics done by Government of India. So whoever doing, because we do not want to waste our time, only we can take that secondary sources as part of our research, because it is only that is this background. It will help us our research work, or maybe some specific purpose. It will help us our research. Doesn't mean that one we have to do statistics our own. No. So whenever you are taking any statistics from any source, whether it's a government or any other agencies, you must and should cite, because you have not taken undertaken any survey or statistics. You are taken. So that's why, particularly in the case of years, many a times, for example, history. So many a times there is a very big problem, even in the law. Also, these laws and all related, because whenever that particular dates comes, years comes here, so we do not know whether that is correct or not. But when you are taking from particular source, so that is the source we have to give acknowledgement, because if particular year it is the correct or not, that is depends on that original work. No problem. Even whenever you are you can take tables which are relevant to your work. You can take figures without that from because all the tables, figures, diagrams, appendices are not free. So these are, you have to take permission, prior permission from the authors. Sometimes if it is open access, you can straight away you can take up. Otherwise, even if it is a needed copyright, you have to take permission. In both cases, whether it is a open access or taken permission, but as a research scholar, as an author, you must and should cite. Okay, and in the case of tables, figures, diagrams, appendices, you have to put under that figure, table, diagram, source, this figure adopted from so and so author and year. Like table also, that you have to put, this is the table adopted from so and so work, means author in the bracket year, if it is needed, page number. Okay, so like that you can put. And whenever you make specific reference to work of another, sometimes what happens here, this is a very interesting. See, you are reading many articles, particularly you are doing a particular research, okay, and somebody has also did the same kind of research in other country. So their findings, your findings, sometimes when you are putting in a cross reference, means here you have done particular research on particular area, then as per your study you found something. So according to your findings, this will tell you. But the same one, if it is a similar kind of problem, for example, use of internet, okay, that is study you are doing among the teachers or faculty. Okay, so the what are the biggest problem out of your study? The major problem is the internet speed. Okay, bandwidth, internet bandwidth. Okay, and Wi-Fi problems. So the other countries also, what kind of problems? Suppose if the same problem is there, you can attest the similar kind of my findings are attested by the similar study recently conducted by so and so and that one. Of course, sometimes if it is within the India also, in a particular Bihar and particular Delhi, the same kind of study is taken. So, but the problems, whatever it is in Delhi, it's quite different from this Bihar. So that is the case. What happens here? In that is the case. In contrary, it is a opposite also. You can write. In whatever case may be, these related studies are basically meant for cross-referencing purpose. So you have to cite it and use someone else's work that has been critical in developing your own research work. What does this mean? Suppose you are doing a particular research work on evaluation of websites, evaluation of web of facts, evaluation of the online systems, evaluation of plagiarism softwares, and any kind of system. So there is no need to develop your own criteria. Somebody is already developed some criteria, but you can take their criteria and also you can improve according to the present circumstances and present the environment, present context. So that's the case. What you have to do here. So in your work, so this present work is the based on the checklist developed the based on the previous works of so and so, so and so, so and so, and with the major modifications or minor modification. So this has to come in your research methodology in the chapter 1. So that's why it is use someone else's work has been critical in developing your own. And sometimes when you are taking a particular research topic study, so that is there is some class sometimes based on one article you like it very much, very classical one and very interesting one. So based on that one, you are forced to take particular topic for research. So that is the case. Somewhere you have to mention. So this is even in the review of literature also. Whenever it is that review of coming, so some of the classical works, this is the prominent work in this my area, and this helped me to this, you have to write. And finally, sometimes controversial facts are there, sometimes opinions or dates which are might be challenged. For example, some emerging topics you are taking, so which are in the controversial facts means here. Sometimes what happens here, particularly law, some cases going on particular issue. Okay, but as of today, whatever it is the available information in newspapers or media, so you are taken as a your work. But later when you are submitting or after submission, that the case may be settled and it is the facts whatever you have mentioned may be false. So it becomes controversial. So that is the case. What happens here? You can save if you are citing that sources according to that particular properly. So then these are not yours. Whatever that time it's available, I cited that is the facts given by the original author is responsible. Even in the case of opinions also. Many a times these opinions you are seeing the politicians they will give you some opinion. Immediately next day it will come another opinion. So like that there is a dynamic nature in the opinions. It may be sometimes goes positive way, sometimes a negative way, sometimes disappears. So that is the case. Uncertainty, wherever uncertainty is there, where this citations help you, it will save you your skin and your reputation and so on and so forth, including your job. Even some dates. The many a times, as I told you, in the history, if you refer a particular dynasty and different books, different dates coming here, because in history so many different sources are there. So that is the case. Whatever you take that particular book, but you cite properly. So that is the case. If it is that date is correct or wrong, that is the original author knows. Okay. So this is the basically it is a very much needed. So this is the why we have to give citations, where we have to give. This is the helping. Now coming. So when you are allowing citations, basically allows acknowledging how the scholarship of others has contributed to your own work. This is one. And the second way, it will help you. It will distinguish you for readers, those who are reading, which ideas are your own and which are borrowed. Because when they read this, your article, chapter, thesis, easily they can find out. And it will also give you, readers, a path by which they can trace the intellectual development of ideas, whatever we are presenting in our work. finally the citations avoid an act of fraud, that is a plagiarism. So this is a simple background about the references and citations. The next part we'll discuss. So this is how citation and academic honesty will help you. Because any research, academic honesty is important, and as per the academic integrity UGC regulations 2018 very clearly, there are so many. There are 4 levels are given: level 0, level 1, 2, 3, and different punishments for research scholars and the faculty members. And there are legal the procedures also there for the that is for illegal copyright. Okay. So to maintain honesty, the citations are very important, because the otherwise knowingly presenting of others' work or one's own, it is treated as the demanding the work is our own. So that is the case, you have to pay penalty later on. And if you failure to give credit for quotes or unique ideas, that definitely it will result in null in your research as well as other discipline actions. Okay. So this is that there are so many regulations in force, particularly as I'm quoting this anti-plagiarism, anti-integrity, this the UGC regulations 2000 that is there. And any point of time, even if it is a particular degree is awarded, afterwards also, if they found it is a plagiarized, so then they may be taken back that degree, or even job also you can lose it. So that is to avoid disciplinary action always. Credit must should be given to original author of information that is not generally known as it is a very unique or maybe research. So now I'm coming to the second part. So the second part is the brief description I will give you, not much, because there is no much time left out. Only what are the referencing. Okay. So normally, you know, by this time you know what is reference. So reference basically what contains a reference usually contains name of the author, date of the publication, and the title, and the journal name, and the page numbers, issue number, value number, issue number, and pages. If it is in the case of online, then URL comes or DOI number comes. Okay, so that is the normally a particular reference contains. And the where we will find it reference, we will find in 2 levels. First one is the first you need to give a brief reference in the body of text. This is called in-text citation. So means here when it is in the running the matter in the chapters. So wherever we have taken that, we are putting double quotes and we are giving author and year according to our style. That the styles we'll discuss later. Okay. The second part is that in text, and the second appearance it will come in the form of, if suppose every chapter you are giving references, or in the end of the article you are giving references. But for example, in the case of MPhil dissertation or PhD thesis, sometimes every chapter also having at the end of the chapter the references are there related to that particular chapter, and at the end of all the chapters there is a bibliography also there. So means here the bibliography at the end of the research work you have to give, and along with the references in the preceding chapters. So that's why, so both places you will find. So this in-text and the bibliography or references and bibliography also. Okay. Now question comes here, what is the difference between reference and bibliography? Many times you are confused, and many times you are telling both are same. Not same. References are sources of information or statements. For example, books, journal, articles, websites, and so forth, which has been used in writing in a manuscript or book or thesis or article. Means here, if you are taken some piece of information or figure, table, or any kind statistics from any book or this one for writing any article, book, or thesis or anything, so that will come in the reference. Means here, if you are taken particular portion of information, may be textual, may be numerical, may be graphical, whatever may be, so it must and should come in the reference. That is that. But what is bibliography? Bibliography without you are taken exactly, you are not taken a particular line, particular figure, particular table, but it must and should come in the bibliography. Why it should come? But some ideas you are taken, but you are not cited, you are not taken original, but you are taken idea. So that also means here the bibliography, which includes all the references list, not only those sources are included which have been mentioned in the in-text citation, but in the bibliography, both references also part of parcel of bibliography, plus which are not uh, available, not cited also, it will come in the bibliography, because some of the classical works which promoted you, or you are taken some good ideas from that particular classical works, that also comes in the bibliography. Means without taking some piece of information also, we can put in this bibliography. Means a bibliography is a list that includes references already cited, but may also contain details of other documents you have consulted, but you have not mentioned directly in your research work. That's why the bibliography are allowed to mention the sources which have used to gather the background information, but are not mentioned in the document as a in-text citation. So this is the difference between a reference and bibliography. Even sometimes we are going for interviews in the CAS interviews or any direct interviews also, in the research methodology, this kind of questions may be asked. Sometimes you are seeing so many abbreviations in your this ones like EBID, UPSEAT, LOCSEAT, and all this. Sometimes it is very confusing also. Okay, but what is the, for your, just for information purpose, I will explain you. EBID. EBID means here this is abbreviation of this Latin word Ibedia. Okay, meaning is same. Okay, this means the reference to the same author and same source in the immediately preceding references. For example, EBID refers to immediately preceding reference. So, for example, in your study, a particular author you are mentioning 2 times. Instead of first time you are already given reference, the second time again you have to give reference. In the case of that references, same one, you can put EBID and that only page number will change, because the other bibliographical details of that particular reference is one and same. So that is the case. This you can put. Second one is EBID immediately, means here, for example, Madhusudan author. Okay, 2020 is there. The second immediately preceding the reference also again Madhusudan 2020 is the same work, but page number is different. So that is the case. First one is Madhusudan full citation. The second one is you can put EBID and means it is the same one and just page number that is varies. The second one is opposite. Opposite means here again it is a Latin word, opus citatum. This meaning work cited. So when it is, this refers to prior reference by the same author. Suppose the same one particular work is there, classic work is there. So naturally you have to cite that one within your work, within your research work. So that is the case. What happened if it is in the particular chapter or particular article, if it is not coming immediately, means here first I told you in the beginning, Madhusudan 2020. The second one is another author is coming, but the third one again Madhusudan comes. So that is the case. EBID may not work. You have to put opposite. Opposite means here. So this is, you are already cited that one, but not above that one. So maybe somewhere, maybe it is coming number one, first one, number one author in your references list, citation number one. Again, the same author, it is coming in the your references at number 20. So that is the case. Again, there is no need to give full details. Just you can give opposite. Okay, and means again you can give that the page number. That so means it refers to the reference listed earlier by the same author. So that is it. So the EBID and opposite basically what happens. So EBID means here immediately first, second, third house same author is coming. You have to use first author, first one full, and second, third one EBID. So this opposite means here first one again it is coming at number 6th. or number 5. So that is the case, you have to put the opposite hand. So then there is another one is loxit. So this is again, it is a Latin word. It is a loco citato, meaning in the place cited. So in this is a normally what happens whenever a footnote or endnote term is used to repeat the title and page number for a given author. Means this loxit is used in the place of ibid. Okay, so when the reference is not only to the work immediately preceding, but also refers to the same page. So that is the case. So nowadays there is no problem. This automatically it will come. So maybe understanding it is a very difficult, no problem. So now referencing styles. There are so many referencing styles there, and uh, and every in social sciences are different, sciences are different, humanities are different, and so on and so forth. No problem. But all these styles, whatever style may be, that in later stages you can I will give you description about styles. But whatever style, whether it is a MNA, whether it is a APA, whether it is a the another style, no problem. All styles are good. Reference styles are good, and there is no problem. But only thing is, what are basically if it is MLA and APA, okay? But the only this order of appearance of title, order of appearance of author name, page numbers, publication date, and some conversion punctuation marks, sometimes use of italics, sometimes emphasis, parentheses, quotation marks. This only varies. It will not change whether it is a MLA or that is a APA style. So the author name is remains author name only. This title is title only. Journal name is journal name only. Value number, issue number, page numbers, nothing. But only thing is, in APA, the year after a year, this author, this year comes here. In MLA, so that is the year comes here, not immediately followed by the author, but it is comes after this this is the issue number, value number, issue number followed by year comes here. So, but somewhere it will, but details are there, but the location may be different. Sometimes double quotes title comes, sometimes italic comes. So this is the only variation. That's why the publishers or the academic institutions, they will decide their own citation styles. For example, that is University of Delhi. The prescribed style is Chicago Manning. So nobody knows this one, and they are not much used worldwide. But this is sometimes they are forcibly you have to put it. And some journals you have to provide all the references API. Again within the API, again the edition comes here. Present edition is 6. MLA present edition is 8. So that is the styles may be broadly categorized. So these are basically these reference styles are categorized into 2 types: documentary note system and parenthetical system. So that is the based on this one. So mostly widely used the referencing styles in the world are these. Okay, first one is APA. APA stands for American Psychological Association. So this the APA is a very famous referencing style in particularly social sciences, behavioral sciences, education, psychology, anthropology, and the next one, and in the world APA followed by MLA, Modern Languages Association of America. So this these two accounting for 90% in the world. If you see any work, okay, 90% of this these only 2 styles are occupied by 90. Remaining 10% occupied by remaining referencing styles like Harvard. This is Harvard style is more and more used in this business. Okay, and Chicago style, social sciences, biological sciences, and there are other particular subject related also. For example, chemistry. That is a style is ACS, means American Chemical Society. There is a separate style, and physics AIP, American Institute of Physics. This is a separate style for, and IEEE. This is a very famous any engineering and technology journals. So you will find all the references according to IEEE standard reference style. So maybe you are from, many of you from engineering or technology. or if you wish to publish in that also, you have to this. And there are so many small ones are there like Vancouver and others also, no problem. So basically, the important ones are as far as the reference styles are concerned, MLA and AP. These are two big rivals. Okay, and APA present edition is the 6th edition. It was published in 2010. So in this, what happens here? The all citation must be in a hanging indent format with the first line, the flush, the left margin, and all other lines are indented. And in the APA style, so the second line and third hanging line, it should come this the fifth character. Okay, and the MLA standard, that is MLA stands for Modern Language Association of. The current edition is the 8th edition, which was published in 2006. It uses parenthetical system. So means here, in brief, in text reference contains name of the author and page numbers of the source. For example, Madhusudan, comma, that my article having 1 to 20 pages are there. So here it is comes here, the page number 1 to 20 comes. In the case of article, in the case of book, particular page number. In the case of other, that is a pair. So in the bracket, it has to provide. That's why it is called parenthetical system. APA is not a parenthetical system. The problem basically what happens, these citation tools maybe as a librarian, you know very well, LISA, Library and Information Science abstracts are there, where this is when you are searching particular Web of Science, Scopus, LISA, these are the bibliographical databases, citation databases. So where you can search any key terms and you will find related articles, whatever you are choosing, that immediately that the selected the works, you will get it, the citations without any problem automatically comes. According to MLA, according to APA, again edition, all it will come. But because what is the problem? This Scopus or Web of Science or LISA, all these are paid commercial. But now today you are working from home. Okay, tomorrow is Sunday. Suppose normally what happens when we are working, we are in the campus. Okay, we can access Scopus, Web of Science, LISA, and other databases. But if we are not in the office, or then it is if you want to make the citations, we cannot use, because this Scopus, Web of Science, LISA, and other, these are IP based resources. So that's why these are commercial nature. So there is a pass. So that's why my focus is, even if you are not in the office and there is no possibility this IP based or commercial site, this is the citation databases, how you make the citations without any problem. That is my idea. That's why to solve this problem, my second option is this. So web-based citation tools. So these tools are basically free. Okay, you can make without any knowledge, whether you have knowledge about MLA or style or APA style or any other style. Without any knowledge, you can make very efficiently and save time. So that I will give you a live demonstration later also to help. So whenever you are taking these citation tools, there are two important aspects are there. So that is tools having, whenever you are selecting, that particular tools having manual and auto cite. So suppose a particular journal, it is only printed is there. So particular book is only printed version is there. So then you have to give manually. You have to enter manually all the detail, bibliographical detail. Biblio means book. Bibliographical means details about particular book. Okay. So simply fill out a form to provide the necessary information and select your preferred style. Means the manual means, for example, you are taken some information from a particular article. Okay, which is only printed journal. Okay, so that is the case. The fields comes here, author. Then you have to fill author surname, forename, title, title of the journal, issue number, volume number, page start, page end, and your URL and DOI. All these details your DOI, it will not come, URL, it will not come. Only these things you have. But suppose if the same journal is also printed, also available electronic form, or book also, the printed book also available, and the same one it is also available electronic. That is the case, there is no need to fill any details. There is a called auto site. The moment you can search that one, automatically whatever fields required information is about for this making citation, automatically taken by this the tools. So automatically it will take, for example, this the author, surname, name, title, the journal name, issue number, value number, ISBN number or ISA number, all details. So this is just like searching Google and getting information, but here I will show you how beautifully it will save a lot of time. So if it is not if it is not online source, so then you have to go for manual. Okay. So now this is the free web-based citation tools. There are so many available for you, and you can like this. The list, few of them important ones are I'm giving, and you can search remaining. So whatever I'm showing here, this list, please observe very carefully. The first one is the name of the tool. Tool means software. Okay, BibMe. So this will support MLA style, APA style, Chicago style, Turbinian part. And this is also available both manual and auto site. So whenever you are choosing, so you can choose both manual and auto site. And the URL is this one. Okay, like this, there are so many. Bibomatic. This also supporting same MLA, APA, Chicago, but this is only having auto site by ISBN number. There is no manual. Suppose if you are choosing this kind of web-based tool, suppose some book is there, only manual is there, and printed one journal there, so there is no possibility to enter this. Okay, and Bib Builder, MLA, APA, Chicago. Okay, coming to, there are so many other Citation Builder Pro, Citation Wizard, 21 CIF, citation, so many are there. You can see URLs, whatever it is coming, just you click it, it will come here. Okay, and Citation Mission, this is also very good, and I will give you a demonstration of Easy Bib. Okay, MLA, APA, Chicago, Turbinian, and all, and both it is a manual entry, auto cite entry. Okay, and Citation Mission also, this is also wonderful one, because all are more or less same only, but what is the innovative feature of the Citation Mission? Suppose EasyBib and citation, if you take EasyBib, what happens here, it will give you the reference, complete reference, but a Citation Mission also gives how to cite in text citation also it will. So that is the case. So both in text also comes and reference citation also comes. Okay, and there are so many, and according to your purpose, according to your need, according to your subject, and according to prescribed standard by your the proposed journal or proposed publisher, proposed university, and so on. So now, in addition to this, there are so many social networking tiles also there, like Site You Like, Canotia is there, Mendeley is there, ResearchGate also there. Of course, ResearchGate may not provide you, but it will provide you full citation. But Mendeley is a very good one. Okay, so Mendeley you can make that is from this very good the bibliographical. It is a not cite that is citation is the management tool. Okay, that is whatever you have seen earlier is a creation tools. This is a management tools. So if it is automatically, if it is there, so you can with the help of this Mendeley, you can organize your thesis or dissertation that you know very well. Okay, but my focus is here. It is the free-based citation, not management tools. Citation creation tools. Okay, there is a difference. So that is a commercial one. This is a free one. Okay, I will give you live demonstration followed by your answers. Okay, so this is a BPME is there. So this is the only thing is these are free. So when you are selecting, you must and should be very careful about the standard, and you have to register. Okay, and it is a free, and only for these cases BPME or EasyBib, all these up to citations it is a free, but these days these tools also having other features like plagiarism checking also, sometimes other services also. Those are not free. So, and since these are free, sometimes when you are using this one, on the left of right of your screen, some advertisements also coming. So because these kind of tools existing because of this advertisements, so you forget that. Okay, so this is the way. This is the citation mission home page. This is the BibMe home page, and this is the easy bib. I will show you. I will show you different according to you. You can also go through. This is my article. So there is a, I did online citation tools, a comparative study. This article is published in World Digital Libraries in 2017. Very good. So you will get further knowledge about in detail about what features having what each citation tool. This is my student MPhil dissertation. Okay, and I also written one good article. Use of online citation tools by students and research scholars. This was published in DCDOC journal. It's a free one. You can go through this one, and it also gives a very good survey and I'm also thankful to all the authors, websites, and all this one. Now it's time to for thanks, and this I will go for the live demonstration of this tool. Then you will realize. So, is it visible now? Is it okay?
But your screen is not.
Not visible?
Nahi.
Okay. Okay. Now I will. Now
So
I will share
your
the screen.
PPT is not visible. Please
No,
share.
PPT is over, madam.
Okay.
PPT is over. Now I will give you live demonstration. Again, I will share you. So before sharing, I will tell you all the participants. What you do, you give your choices. You give me any article name, or you give me any book name. Then how to cite according to your, because I will show you one demo according to you have to practice. Very easy. Now again I'm going for for a live demonstration. Okay. Again I'm sharing, and keep. You can also put in that one. Or the better you can tell me. Otherwise it is difficult. Okay.
Sir, one question is there. May I please?
Okay. Let me for complete first. Then you ask me. Okay.
Sure. Sure.
Okay.
Thank you, sir.
Okay. Now, is it visible screen?
Yes, sir.
Screen is visible?
Yes, sir.
Okay. Now what I'm telling, if you do not know the URL, I am already given that URL, but each tool is there. If you do not know, no problem. Now you can type like this. For example, easy bib. Okay. Easy bib. Okay. So in the Google, you can take this one, it will come. Okay. Now it is easy. Okay. So now this is the citation creation tools, not management tools. Okay. So management tools means that Mendeley comes here. It is very easy. This is free. Okay. This is called citation generators. Okay. Now you are, it will come like this live demonstration. You can ask any questions. I will show you. Okay. The best way is, okay, you have to sign it. That is a better, because if you sign, what happens here automatically, it will give you, suppose when you are doing research, the references, it is not one day. You are taking maybe you are putting some 5 one day, 5 Tuesday, and after some time, every time within the month you are giving. So these tools, what happens here, as and when you can put here, it will create and it will maintain alphabetically. So this is the best way. Whenever you are using that one, you can directly download that file and you can append along with your chapters. For example, your thesis having 6 chapters. So that is followed by this the bibliography. This you can download from EasyBib, and just you change the page numbers and attach. Automatically, it will give you Word file. So that way, it will save you a lot of your time, tension, because those who are in the verge of submission with a very short span of time, and that is the time you are so much and so pressed with the time and the other problems. To avoid that problem, these tools will help you. Okay. So I'm logging. Even without login also you can do. Okay. Okay. You can give and you can enter. Just you can go. Okay. So without you can also do this one, but when you want to download, then it will ask you. Okay. So this is a way you have to come here, and when you open this one, signing is free. First time you have to click on sign up, and it will come your one. Okay. So now this list also what you have done, all list it will come, all citation list. Whenever you are doing this, all details it will come automatically. Okay. Now I will give you good one. Okay. So this one you can go for first one is you can go for new one. Okay. Okay. Go to my papers, or okay, you can go for you can go to dashboard easily. Okay. So in this one you have to choose citations. Okay. Citations. Okay. And it will ask you. Okay. So what you want to cite now? Okay. So now you have to choose this one first. Whether you want to which source, whether it's a journal, whether it's a website, whether a book. Okay. So I'm checking this journal. Okay. So journal it will come. There are so many others also there. If you click this one, so many are there. Newspaper, film, all of them, so many are there. Okay. So then you can go for this the way. All the details are there. It will come here. Then later on you can go through. Then you can come. Okay. I'm directly I'll create this one. Okay. I'm taking journal. Hello. Hello, madam. Hello. Hello. So here, there are two things are there. Okay. So whether you want to go this directly, you can search. This is the auto site. Otherwise, you can create manual also. So now I'm giving first source here. It is a you can search here any time. Okay, anything. So whether it is a title or anything, I'm giving here.
Sir, you are not audible. Sir, your voice is not coming.
Now it is okay?
Yes, sir.
Now it is okay? Okay, sorry. Okay. Now you can see, I will again back. Okay. Now, where is that? This. Okay. This one. See, what I did here is this one. This is what I just now I prepared, but this has come. Okay. Madhusudan Margam, internet used by research scholars. Okay, all this one is there. So there are so many options available. See, it will arrange according to earlier I put this one, Salikdar, Madhusudan, digital, this nomadium. Okay, alphabetically D followed by M. So there are so many options available. You can copy this one as it is. You can export to. You can sort by this one. All it will come. So the all tools also same similar. Like this, you can go for MLA 8. The other today listed it is there. Okay, my citation list according to all this one. You want to create again new, like you create new citation. I will give you one example and I will close this one because of time. Okay, for book. Okay, just I will giving another one is book. So same one. If you are asking, it will come you auto site. Just click on book. Okay. Now just tell me anybody book name. Any book name? Any book name? Any book name? Anybody? Websites. Okay. I'll give you one book name is websites. Okay. Simple one. Okay. Just you can see. Any other? You can search it. It will come all the list. Then you can choose what is your author, exactly what you are cited. That one it will come. So now see here, this is a there. Okay, website. This one is the site. So automatically, according to that standard C title, publisher, year it has come. Just click on site. Continue. Then final, this details it will come you. If any sometimes a forename, surname, if any problem is there, particularly Indian authors, sometimes we don't know surname, we don't know forename. So that is the case. Okay. So complete citation, all it will come. Whatever details are there, all it has come. See, this is auto citation. Okay. And because this is not a journal, there is no filler. Finally, completion. If any changes, you can make also. Okay. This is the way you can put here, automatically it will come. Okay. When you see this, your list, all it will come. Is it clear? Now it's the time. All of you, if anybody having any questions, just you tell me that I will answer. Because of this time, I am unable to show you more the tools and more examples. But it is a very easy, as I gave one example of a journal and also one example of book. So automatically comes according to it. There is a list. It is coming. You can put it. Anybody having?
Hello. Am I audible,
Yes.
sir?
Yeah, yes. What is
Sir,
your good name?
thank you for. My name is Dr. Shailesh Kedia. I am from Nagpur, Raisoni College of Engineering.
Okay, sir.
It was really a nice session, sir. Thanks a lot for that. First of all, sir. Another thing is in citation, what I have seen that in Google Scholar there are very less articles which I am finding of myself. I have written a lot of articles, but Google Scholar have not catched it. So once I am doing manual
yes.
addition, those manual additions
Yes,
are
sir.
not fetching any citations. So can
No,
you
no,
please
no, no,
advise
sir.
me?
It will take. Okay. This is not related to the bibliographical citations. Okay, but of course it is allied one. Okay, a good question, because the Google Scholar automatically, sir, automatically it will pick you once it is uploaded a particular article, particular book on the website. Am I right? So sometimes,
Correct, sir.
sometimes the same names, different names of same names are there. Instead of coming to your name, it goes to some other name also. Okay, and some others works also comes to your mail also. So if that is the case, what we have to go? We have to go manually, sir. You can, there is a possibility in Google Scholar. So again, you log in with your email ID, then you can see that one. I can then manually you can enter article or book. It will definitely, it will come, sir. Any other?
Okay.
Sir,
Thank you.
hello, sir. This is Deepshika here.
Yeah.
I would like to know, sir, when we write any article,
Okay.
a research paper, how much of the part from that can be the cited part, and how much has to be our original? Is there any demarcation to that?
Very good question and very typical question. Very nice question also. Okay, madam. Actually, as of now, there is no such standard. Okay, because every article is not in the same size. If it is a same size, then there is a standard. Okay, because it varies from article to article. Sometimes maybe comprising of 5 pages, maybe 10 pages, 20 pages, 30 pages, and so on and so forth. Okay, so uh, in general, as with my experience, everything, you will not find answer in any question, any book, anyone. Only some experienced person only can answer this one. With my little experience, okay, maybe this answer is it should not be more than 30%. Okay, in some extra, some more exceptional cases, it goes to 40%. Okay, but not more than 50%.
Hello, Madhusudan
Yes.
sir.
Sir.
Very
Shall I
nice
close?
session.
Okay.
Very nice session.
Thank you so much. Thank you so much.
Very
It is,
wonderful. And
I am unable
on
to
the
give live demonstration of many tools, live demonstration very less. Okay.
okay, sir. But in the short period, you have given the very wonderful session. And on the
Thank you.
behalf of Dayalbagh Educational Institute, we are thankful to present and accepting our invitation.
Thank you so much. This is all because of you. Okay. Thank you so much.
Okay, thank you, sir.
Witnessing
And
okay. Can I close?
okay, sir. Thank you, sir. Now I request to all participants, please join 225 session of validity ceremony, and please ready to share the feedback of the FDP in the last 5 years. Okay. Now this session going to close, and we meet in next session validity ceremony 2:25 sharp time. Okay, thank you, sir.
Thank you very much. Because of this
Thank you,
shortage of time, I am unable to give you more the practical exposure on creation of citations. But I am sure if those are very much interested, you may contact my email or you may contact me. If you are coming anytime University Delhi, you are most welcome. I will help you. Okay. Thank you very much. One and
Sir,
all.
sir, please send your PPTs. I will share with the participants.
Okay, okay, sir. I will share. I will share.
Okay.
I will send
Thank
you
you.
now. I will send you.
Okay, sir.
Shall I close, sir? Now?
Okay, sir.
Okay.
Meet again in 2:25.
225. Okay, okay, okay. Thank you so much. Thank you so much.
Welcome back again, everyone. Now it's time for valedictory ceremony. I would like to welcome Mr. Brijpal Singh, the coordinator of this FDP, librarian of Faculty of Integrated Medicine, DEI, to proceed the program further. Please join us, sir. There is some technical issue from Mr. Brijpal Sharma's side. Mr. Brijpal Singh, the coordinator of this FDP, librarian of Faculty of Integrated Medicine, Dayalbagh Educational Institute, to proceed the program further. Please join us, sir.
Thank you, ma'am. Thank you.
आगे 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 आगे
हेलो
हेलो, आपको आवाज आ रही है मेरी? हेलो,
नहीं आ रही, sir.
कैन यू हियर मी?
सेकंड भी है
कोई रिस्पांस दीजिए, आपको मेरी आवाज आ रही है?
आवाज नहीं आ रही सर की आवाज नहीं आ रही सर की आवाज नहीं आ रही
प्रिंसिपल साहब, कैन यू हियर मी? से यस और से नो प्लीज.
इंट्रोडक्शन है आपके पास दो सर की आवाज नहीं आ रही है सर
मुझे आपकी आवाज आ रही है. आई कैन हियर यू.
चलो हाँ बोलो
ओके.
Now, I would like to welcome the chief guest of our this FDP program, Registrar Sir of Dayalbagh Educational Institute, Professor Anand Mohan. He has a rich experience spanning up to 23 years of graduate and postgraduate teaching in the areas of metamorphic, petrology, mineralogy, Precambrian, geology, and application of thermodynamics of petrological problems. Professor Anand Mohan has 50 research papers, 275 citations of publications to his authorship credit. He has also edited a book entitled Milestones in Petrology and Future Perspectives. He has earned several distinctions and awards like National Mineral Award from the Ministry of Steel, 7 Mines, Government of India and Indian National Science Academy, Medal for Young Scientists, many more. Please join us, sir.
Valuable address.
Please join us, sir, and address us for this workshop.
Thank you. Dr. Rajneesh Sharma, Principal of Ayush Faculty, and Professor Swami Pyara Satthangi, Coordinator of the Ayush, and others distinguished
सर को बोलो सर की आवाज नहीं आ रही
delegates and
इनको फोन पे ही
members.
बात करेंगे
अंशु अंशु तेरे आवाज नहीं आ रही. कहाँ है लीव मीटिंग? अभी आवाज आ रही है?
Sir, your voice is not audible.
कहाँ प्रॉब्लम है सर
कोई लिख रहे हैं सर आ रही है सर यहाँ और कुछ आ रही है चैट में देखिए चैट में सब एवरीबॉडी इज राइटिंग सब लिख रहे हैं चैट में आ रही है सबको यहाँ लोग लिख रहे हैं उसमें क्लियरली ऑडिबल यहाँ नहीं आ रही है हमें नहीं आ रही
है
Am I audible now? Can you hear me? ये 2 मिनट बोलना है ठीक है. वीडियो कैन स्टॉप.
आ गई हाँ सर अब आ जाएगी बोलिए सर
अभी आवाज आ रही है आपको?
जी 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 सर जी सर
ओके थैंक यू.
जी सर
So let me start fresh. That I'm very happy today to address this valedictory function of the online faculty program, which was supported by AICTE and Atal Academy program on the research support services in the academic institutions. I congratulate Dr. Rajni Sharma, who is the principal of Ayush faculty, along with his team of the organizing committee members for organizing such a innovative online faculty development program. I am so glad to hear that more than 100 participants have joined this program online from 24th till 28th of August. And there were very distinguished 15 speakers who have addressed the candidates from across the globe. Some of the features that I have come across after reading the brochure, and I'm really impressed, is that the new education policy 2020 was discussed, and there were people like BP Singh from DI who made a dent on the e-information sources, accessibility and discovery. There was also research support and innovation management in the university libraries that was set by Dr. Sanjay Kataria. Some of these lectures have impressed me. I have read some of the abstracts as well. And my impression is that this has been an excellent program that has been organized by the Ayush principal and his organizing committee team. I congratulate once again to all the organizers for this excellent job. And I also congratulate the participants. I'm sure that they must have been benefited immensely from the outcome of this 4-day workshop of the Atal sponsored online faculty development program. And I look forward that such programs will continue in future by this university, the Dayalbagh Educational Institute, deemed to be university. With these few words, I would like to once again thank you for giving me this opportunity to address the valedictory function of this 4-day workshop. Thank you so much. Namaskar.
Now, Mr. BP Singh will do thanks to Registrar, sir.
Thanks to our honorable Registrar Sahab, Professor Anand Mohan sir, accepting our kind invitation to present a validity address and provide a such moral support to conduct this program. We are really thankful to Registrar sir. Always he gives the very valuable suggestions and advice to conduct such type of programs. Thank you, sir. Please accept our thanks.
Thank you very much. Thank you to all your team
Thank you.
for this very, very inspiring program that you have organized. I am so glad, and thanks again once. Thank you.
Sir, I hope you will be give the chance in future.
Sure.
Thank you, sir. Thank you.
Thank you. Please continue.
Hi. Okay, thanks. Now I request to all participants share our feedbacks and say something about the program and suggest any modification and revisions and suggest topic for the future organizing such FDP by the Dayalbagh Educational Institute.
if anyone from the participants would like to say something regarding this 5 days online FDP and wants to share their experience, please come to share their experience.
Dr. Vijayan Pradhan, please introduce yourself.
Good afternoon, sir. Am I audible?
Yes, sir.
Okay. Respected principal, sir, and all the members of DEI, and my dear friend Brijpal Singh, and all the colleagues who have joined from across India. It was really a wonderful session. 5 days was spent very successfully, and I congratulate Mr. VP Singh. And the topic he has selected was quite good. And all the sessions, although it was lengthy, but it was very fruitful. And especially our Madhusudan sir and all these lectures, what he has presented today, it is very quite useful to the researchers and research scholars, and for future research work. And regarding the lectures, I also found very useful some of the lectures, like Mr. Nishant Singh from DRDO and Dr. Rajkumar. Professor Saurav Agrawal sir, he has delivered lecture on SPSS, and Dr. PK Singh, and today also Dr. Rajni Sharma sir. He has really delivered one of the most beautiful lecture, although it was slightly out of context, but it was very useful for our daily lives. And mental stress, as you know, everybody is facing some challenges today due to pandemic or whatever situation. But this lecture was quite useful, and I thank once again from my bottom of my heart. And once again, I congratulate the whole DEI team, Mr. Brijpal Singh, as well as both the co-host, Dr. Ankita and Dr. Suman. They beautifully organized all the sessions quite well. So thank you, all the organizers.
Thank you, Dr. Thank you, Dr. Pradhan. And
hello, this is Dr. Khushbu Kumar. Hope I am audible to all of you, sir.
Yes, ma'am. Please.
Yeah, a very good afternoon to all the respected faculty members, resource persons, and all the participants. We all have come across to the end of this FDP right now. And I am happy that this entire FDP has been very fruitful, insightful, informative, and most of them were interactive. So it has helped all of us, not only to the research scholars, but also to the faculty members to gain some less talked about information that is there in the research, and how to promote these kind of research in our research scholars, in our institutions, for the betterment of the organization. So I'm really thankful to the organizers, especially BP Singh sir, who took such a pain to organize this speaker as a guest, especially me. I am feeling privileged, blessed to have attended all these sessions successfully, and really gained a lot from this entire FDP, and will try to amalgamate all these informations in my research scholars study. So thank you very much, sir, and I'm really looking forward for such sessions in the future also. And congratulations to all of you, sir, for conducting such a session successfully, sir. Thank you very much.
Thank you very much for your kind feedback. Now I request to Dr. Sharad Kumar Sonkar from Baba Saheb Bhimrao Ambedkar. Dr. Sonkar, you can listen me? Dr. PV Gante.
Thank you. Very good afternoon to all of you. I'm audible?
Yes, sir. Please go ahead.
Very good afternoon to all of you. This FDP program is quite useful for the participants, as since first day I was learning from various eminent speakers like Professor Ramesh Gaur and many eminent speakers have delivered the lectures, and these lectures was very uh, useful for the budding professional as well as working professional, those who are working in the field of library and information science, and as well as those who are working in the higher education institutions. Because they cover the entire syllabus or content which are very useful for the faculty members as well as research students or research scholars. They have clearly explained all the contents which are very useful, and I hope that the program will be very fruitful for all the participants. So it's a very good initiative taken by the Ayush department from the Dayalbagh College. It's a, so it's very useful for all of us. To thank you for the organizing team who has worked day and night to make success this program. Thank
Thank
you.
you, sir. Thank you. Thank you very much. Now, Dr. P.V. Ghante. Sir, you can listen me? Dr. Ravi Chandra, sir.
Hello,
Yes, sir.
am I audible, sir?
Yes, sir. Please go ahead.
Sir, thank you very much for organizing such a wonderful FDP. I have learned a lot, and in fact, there are certain key points which I am taking forward with this FDP, and I'm sure not only me but my entire institute would be benefited because of this FDP. And top of it, the kind of speakers you have selected, I really appreciate you for selecting those speakers. They have really provided a wonderful insight towards this research area, which is the need of an hour. And I encourage you, sir, to please organize such programs. And if I can suggest some topic, I want structural equation modeling to be the next topic for your workshop. So that's all from my side, sir. Thank you very much.
Thank you, sir. Dr. Ravi Chandra, sir. Any participant? Every participant, please interact with our team and give some suggestion and feedback about the shared FDP.
Sir, I am Ravichandran, sir.
Yes,
sir.
Please go ahead.
I am Ravichandran from Tamil Nadu, sir. I attended this FDP for the last 5 days. It is very useful, and the organizer selected a very good topic in every area, which is useful for every researchers and faculties for their further research activities. So I want to thank each one of you in the adult FDP team for conducting such a wonderful FDP for the benefit of the researchers and faculty members. Sir. Thank you, sir.
Thank you, sir. Thank you.
Good afternoon, sir. Hello.
Good afternoon.
Sir, this is Snehasis, working as library assistant in the Northeastern Space Application Center, Meghalaya. Firstly, I would like to thank the DAE authorities for giving me the opportunity to participate in this 5 days FDP. The program was well organized and nicely coordinated. All the sessions were delivered by many senior and eminent speakers. and were very much impactful for the library professionals, faculties, and other researchers as well. All the sessions were very informative, and mostly I liked the sessions of Ramesh Gaur sir, Sanjay Kataria sir, Rajkumar Bardwaj sir, Nishan Kumar sir, and Madhusudan sir. Based on my research and working interest. And another good thing about the FDP is the streaming the session recordings on YouTube. So as working in office hours, it's a little difficult for all the time means focusing on the FDP. Later, I used to watch the videos so to get all the insight. So I thank the coordinators for successfully organizing this FDP, and thank you.
Thank you very much, sir. Dr. Raja D. Sir, you are listening me? Any participants? Very active participants. Dr. Khushbu Kumar, please something. Dr. Khushbu Kumar ji, you are very active participation during the FDP program. Always he asking many questions.
Yes, sir. I can listen to you, sir. Yes, sir. I have already given my feedback, but really it was a wonderful session. And yes, I was active because I was gaining something and I wanted to learn something from all the resource persons. And thank you for giving me such an opportunity and such a wonderful resource person who always wanted me to ask questions, and whatever doubt was there, they were able to satisfy me with their answers. So I'm really thankful from the bottom of my heart. I'm really thankful to you, to ma'ams who were there to organize all these sessions, who were there to moderate this session along with these speakers. So really, very, very wonderful it was. And I really wish you all the best for your future endeavors, sir. And please keep talking like this all this, sir. Thank you very much.
Okay, thank you. Dr. Muzammil, sir, you want to say something? Muzammil sir, you can listen. Any participants, please interact with us team. If you want to any query regarding the FTP, please our last registered participant, Bhuma Devi. Madam, please. Hello.
Good afternoon to one and all present over here. Thank you for giving me this opportunity to speak in this session, because all the learned persons and all are doctors, and I'm trying to pursue doctorate. So it was very much useful for me in all aspects. Everything I have learned over here, definitely I will apply in my own area. Thank you very much, sir, for giving this opportunity. Thank you very much.
Thank you. Thank you. Any participants? Any your query regarding the FDP? Abha Kwar ji, Madam Abha Kwar ji, 10 minutes remaining to closing the ceremony. Please say something about this program.
Thank you, the coordinator of our FDP program, Mr. Brijpal Singh, and to all the participants
Okay,
all the participants for their valuable words.
Madam, please. Now I request to our guest of honor, Professor Madhusudan sir, say something valuable suggestion and moral support for the next FDP and present education system, research system in as per the new education policy 2020. Madhusudan sir.
Okay, sir. Thank you very much, BPC. Is it audible?
Yes, sir. Please go on.
Respected Professor Kumar Kalra, Professor Somi Piara Satangi, Dr. Rajneesh Sharma, Principal, and Dr. B.B. Singh, FDP Coordinator, and Dr. Suman, Dr. Ankita, and all the team of FDP. It is a great honor for me to be part of this 5-day online FDP as a guest of honor. Really, such a wonderful online workshop. It was designed and developed by Dr. B.B. Singh, and this particular 5 days FDP on development program on research support services in academic institutions. It is a need of the hour, and also it is the need of the each and every participant who has been doing their research and also conducting various projects and so. And this has organized by DEI, Dayalbagh, Agra, and this is a online FDP 5-day online FDP program. Enlighten all the participants' minds and also promoted the participation of research support services in academic institutions at all levels, and share and reuse in future research process. I feel great proud to say that this online FTP making strategic provide high quality research support services in the form of the detailed deliberations, presentations by eminent speakers who has been rich experience in research and the library services and also the academic and research areas. And after going through this, the final FDP program, I saw these topics were so relevant for each and every faculty members, irrespective of their designation, irrespective of their teaching, and irrespective of their working. And particularly, I was interacted in 2 sessions, yesterday and today. So the yesterday I was discussed the research, the projects and process opportunities for faculty members, where I was so delighted to share many good news and the way the participants were deliberated with me and interacted with me so innovatively and creatively. And I seen so many FDPs interacted, so many participants, but I never seen such a wonderful FDP and also such a wonderful these participants. These participants are so in their capacity, they are so and so forth, they are so dedicated and sincere to their the works, and also they are so much curious to learn many things, and also they used to discuss and interact with each and every this the resource person in many ways and means to clear their doubts. I feel very great, proud, say that this is they are building new multidisciplinary research facilities and installing expensive research infrastructures to facilitate research collaboration and support new methods for data collection, analysis, and visualization and storage. And the vital components of the course and particularly delivered by eminent persons. This not only it is useful for their the present research needs, but also it is useful for their future endeavor. With this small briefings, I hope this DEI under the leadership of the coordinatorship of Dr. BP Singh, they will conduct many more areas in future endeavor to focus the librarians and this academic staff and in emerging areas. So that way help not only for their the research but also for their other subject areas to enlighten in their that research indeed. And thank you very much once again, one and all the authorities of DIE, and from my core heart, my special thanks to Dr. BP Singh for giving this opportunity. Thank you, one and all.
Thank you, Professor Madhusudan sir. On the behalf of Dayalbagh Educational Institute, you are accepting our invitation as a guest of honor and give the valuable suggestions for improving our FTP program in your future. Thank you, sir.
Thank you very much.
Now, one announcement for participants. All participants, you complete your feedback on the portal of AICT through login your user ID and password. They are click on the feedback and complete the form, and your examination will be held 4 o'clock. 4 o'clock to 5 o'clock. 25 question only giving you. This Google form link will be provided you WhatsApp group chat box and also your email box. This time is fixed. No further chance to modify and re-examination. Please be alert and complete your exam. Okay, if you any query in this regard, contact to us, any member of our team through the chat box, either the direct calls. Now I request to Professor Rajneesh Sharma sir, please give some suggestions and closing remarks on this FDP.
Thank you, Coordinator Mr. BP Singh ji, and comparer of this FDP, Dr. Suman, Dr. Ankita, Co-Coordinator Dr. Yes Pratap, faculty colleagues, Dr. Deepti, Dr. Tanpriya, Dr. Hari Singh, Dr. Vinay, and Lakhvinder ji, and Guru Kripa ji, and all participants and all resource persons. अब मेरे को लगता है कि ये कंक्लूडिंग है, तो कोई लैंग्वेज का बाउंडिंग तो होगा नहीं, क्योंकि
नहीं सर,
साइंटिफिक सेशन नहीं है ये।
नहीं सर।
तो क्या है कि मतलब इस प्रोग्राम के दौरान एक चीज मुझे बड़ी अच्छी लगी, वो ये थी कि all the participants were so sincere and so decent. I appreciate the participation
Yes,
of so decent and sincere participants. And secondly, every session has been very smooth conducting, very smooth organizing, so everything. So I may do the proud on this team of DI, of this team for FDP, and on the even on the participants, the so decent participant we have. निश्चित रूप से ऐसे पार्टिसिपेंट्स मिलना किसी भी कार्यक्रम को सक्सेस करने का एक टूल होते हैं, क्योंकि डिसेंसी अपने आप में एक सक्सेस होती है, सिंसियरिटी अपने आप में एक सक्सेस होती है। दूसरी चीज ये कि इस तरह के सेशन आज की तारीख में हमें बहुत ज़्यादा ज़रूरत है, क्योंकि एजुकेशन फील्ड में पर्टिकुलरली चेंजेस इतनी तेजी से आ रहे हैं कि अगर हम उनसे अवेयर नहीं रहे तो निश्चित रूप से हमारा सारा एजुकेशन सिस्टम धराशायी हो जाएगा। तो टाइम टाइम पे हम लोगों ने इस तरह के इनोवेटिव और इस तरह के ओरिएंटेशन प्रोग्राम ऑर्गेनाइज करते रहना चाहिए, और निश्चित रूप से उसमें पार्टिसिपेशन करते रहना चाहिए अगर हम एक अच्छा टीचर बने रहना चाहते हैं। तो मैं ये नहीं बोल रहा हूँ कि सब लोग अच्छे टीचर नहीं हैं, मैंने ये बोला कि अगर हम अच्छे टीचर बने रहना चाहते हैं तो हमें अपडेट रहना पड़ेगा, हमें इन सारी चीज़ों से अवेयर रहना पड़ेगा। कारण ये है कि चेंजेस इतनी तेजी से आ रहे हैं कि अगर हम अवेयर न रहे तो आउटडेटेड हो जाएंगे, एंटिक पीस हो जाएंगे, यूजलेस हो जाएंगे। तो ये सारी चीज़ें बड़ी ज़रूरी हैं हमारे लिए। दूसरी चीज़ ऐसी है कि जो भी प्रोग्राम रहा, जो भी, निश्चित रूप से अटेंडेंस बहुत ज़्यादा अप्रिशिएटिंग रही मेरे हिसाब से, तो क्योंकि इस तरह के जो मैं और भी इससे पहले ROTP या FDP टाइप के प्रोग्राम देखा हूँ, उन्हें मैंने देखा है कि शुरू के 1-2 दिन तो मतलब लोग बड़ा एनर्जी के साथ में प्रोग्राम अटेंड करते हैं, लेकिन धीरे धीरे अटेंडेंस कम होना शुरू हो जाती है। लेकिन इट इज़ अवर लक, इट इज़ ऑर्गेनाइजर्स लक दैट ऑल द पार्टिसिपेंट्स सो सिंसियर that they use full time to hear us, though it was online होने के बाद भी इतनी सिंसियरिटी से किसी प्रोग्राम को अटेंड करना अपने आप में एक बहुत बड़ी बात होती है। तो ये सारी चीजें हम लोगों को देखने को मिली, और जैसा कि अभी फीडबैक में मिला, लोगों की भी इच्छा है, बाकी रिसोर्स पर्सन की भी इच्छा है, पार्टिसिपेंट की भी इच्छा है कि इस तरह के प्रोग्राम होते रहने चाहिए। निश्चित रूप से हम आपसे वादा करते हैं कि इस तरह का प्रयास हम आगे भी करते रहेंगे, और उस प्रयास में कितने सक्सेस होते हैं, हाउ मच वी बिकम सक्सेस इन सच टाइप ऑफ आवर एफर्ट्स, यू ऑल विल टेल अस। क्योंकि इस सब में एक टीम वर्क है, इसमें किसी एक का कोई कंट्रीब्यूशन नहीं है। उसके बाद भी आज सब लोग यहाँ पे हैं, पार्टिसिपेंट हैं, ऑर्गेनाइजर हैं, सब लोग हैं। उसके बाद भी बीइंग अ हेड ऑफ द इंस्टीट्यूशन, whatever the success, whatever the gratefulness, whatever the good things has happened in this FDP program, the credit for that good things goes to my team, no doubt my dynamic team, no doubt my vital team. And if there is some fault, if there is some deficiencies, that might be because of my lacuna in observations or managing all these things. So all of those things which are lacking in this program, I take the responsibility of that, being a head of the institution, and definitely this grand success of the program, the credit of that goes to my team, no doubt coordinator, no doubt our conductor, no doubt our other media persons, no doubt our other persons who are helping us, and even since the our technicians who are sitting over here, Mr. Lakhvinder Singh, Mr. Guru Kripa, and all these persons who have here. So it is a teamwork, and I proud that I have this team. No doubt rest of the things are good, and again I thank coordinator Mr. BP Singh and all the team once again. Thank you so much.
Thank you so much, sir, for your valuable words. Now I would like to welcome Dr. Yash Pratap Singh, the co-coordinator of this FDP and assistant professor and academic coordinator of Faculty of Integrated Medicine, DI. I request Dr. Yash Pratap Singh to deliver the vote of thanks.
इसके पहले कोई और कुछ बोलना चाहता होगा तो बोल दो इसके पहले.
Before this, if anybody would like to say something, then please welcome and speak.
Any query regarding the examination? Please tell me. Any confusion, any query regarding the examination? Any other issues?
If anyone have, please drop in chat box or raise your hand in chat box.
नहीं है, चलो.
I think we are done with the queries. Please, Dr. Yash Pratap Singh, you may proceed.
Thank you, Ankita ma'am. We had a great 5-day FDP workshop. I hope everyone have learned something new and informative things from this workshop. This workshop is going to help all of us in our research field surely. Now, I would like to firstly thank to Professor Prem Kumar Kalra, the Director of Dayalbagh Educational Institute, Agra, to give us an opportunity to conduct this 5-day FDV workshop in Dayalbagh Educational Institute. Without the support of Director Sir, this FDV cannot be held. Thank you so much, sir. Thank you to Professor Anand Mohan, Registrar of Dayalbagh Educational Institute, for being with us and encouraging us for this FDP workshop. Now, I want to say thanks to Atal for sponsoring this 5-day workshop in DEI. Atal has gave us an opportunity to conduct this 6th successful FDP workshop in our university. Atal is committed for development of quality and technical education in the country by initiating various schemes launched by Government of India. This workshop has enhanced the knowledge of each of us in our research work. I really appreciate the efforts of Atal for giving us this opportunity. Thank you so very much to the entire Atal team. Now I would like to thanks to all the speakers, Dr. Sanjay Kataria, Dr. PM Nausad Ali, Dr. Anand Kumar, Professor Ramesh Shi Gaur, Dr. Susmita Chakrabarti, Professor Preetvanti Singh, Dr. M. Madhusudan, resource person and guest of honor for concluding session, Dr. Rajkumar Bharadwaj, Mr. Nishant Singh, Professor Saurav Agarwal, Dr. P.K. Singh, and Dr. Rajnish Sharma for giving us their valuable time from their busy schedule and teaching us about research work so nicely. Thanks to all. Thanks to our committed anchors, Dr. Suman Chaudhary and Dr. Ankita Okharwal, for nicely managing and conducting this 5-day FDP program, and our media team, Dr. Swati Pandey and Dr. Ankita, and thanks to Dr. Tanupriya, Dr. Deepti Sarma, and Mr. Namratan for managing the attendance and backend. Thanks to all our teaching and non-teaching staff of Faculty of Integrated Medicine, Dayalbagh Educational Institute, Agra. Thanks to Vinay Kumar sir. Thanks. I would like to thank Mr. Amit Johari, Mr. Guru Kripa, and Mr. Lakhvinder Singh for their technical support. And special thanks to our principal, Dr. Rajnesh Sharma, and coordinator of this FDP, Mr. BP Singh, for managing and conducting this FDP in our faculty. And lastly, thanks to all the participants for listening the entire workshop so nicely. I must say all the participants were very enthusiastic and actively participated in this entire 5-day faculty development program. Thank you all.
Thank you, Dr. Yash Pratap Singh.
Now it's time to end our 5-day FDP workshop. I hope everyone has gained and learned something new from this 5-day workshop. I request to all of you, please stand up for national anthem.
अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे
Thank you, everyone.
जन गण मन
Thank you, everyone. Now you all may please sit. On the behalf of Faculty of Integrated Medicine, Dayalbagh Educational Institute, I would like to thank you all. Thank you all.
This workshop is ended here. Thank you, everyone.
Thank you.
Now you may proceed for your examination and feedback form.